Sir, technician.
Hello. पीछे भी लगा सकते हैं आप इसको, कोई प्रॉब्लम नहीं है, पर ये दिखेगा कैसे? So, welcome to all of you, and this session is also live in the Facebook page of Ayush Darpan Journal. So, now we are going to start this session, and I hope that everybody will enjoy this session. I already explained that the session is divided in 4 parts. We are just doing this for those participants who are joining through the online mode. They want these sessions in the Facebook also. That's why we are just presenting. When we come to the PPT will be present here. So just welcome to all of you. Now I am starting the Marma Chikitsa, the introduction of the Marma Chikitsa. First of all, what is Marma? So many of the people are tell you the AC is working or not. AC. I think that we start the AC also. So, yes, welcome to all of you. Just join. I think the registration process is already completed, and just we are starting this session. You all are, everybody is comfortable? Yeah. The audio is going? Yes. So video, we will just, if anybody has not done his or her registration, they just do the registration counter and just do the registration, as the participation certificate is only given to those participants who will attend both the 2 day session. So please go and do the registration and do your registration. And kindly I request all of you to join the sessions regularly. Don't miss these sessions. So Marma Chikitsa. Now I am starting. Yeah, and also go and sign. Also sign that your presence. Doctor, with doing registration, I request them to take a sign of all the participants on the plain paper that they are present here. Yeah. And also take the silent mode, phone in silent mode. Actually, many of the participants are coming from very far, so please follow the. I think that. Yeah. And you can watch the session on Ayush Darpan Facebook live session. I will just show you the session also in the Facebook live page. And after that, we will also upload this in the YouTube. So I hope that the technical part is now over. And now I'm just going to start the session. So Marma Chikitsa. Many of you know about the Marma Chikitsa. Marma Chikitsa is the knowledge, Vedic knowledge of Ayurveda. And there are 4 folds of treatment mentioned in Veda. One is the Angirasi, another one is the Angirasi, Devi, Manusya, as well as another one is the. Yeah. You can put it in the stage, but I think that in the stage, so it will be visualized to all. So 1 minute, it will be very good. Actually, for 2 days we have to arrange this session. So first day, so we have to clear all the technical glitches, and after that, we will get all the things very fine. And I hope that everything will be very clear. I take home notice is that, and take home message is that after this session, if you are capable to practice Marma Chikitsa or Nadi Pariksha or Agni Karma, will be achieved. So I think that now yeah, just put this there. Now it is visible? Yeah. Okay. Because I have to save the PPT also and many notes also. So that's why these things. So I think that shadow is coming 1 minute. I think that's I will come to this side. This side. Yeah. 1 minute. Yeah. No problem. I will start again. It's not working. Yes, I assume. Nice. Okay, so now let's start the Marma Chikitsa. So Marma Chikitsa is a part of Vedic knowledge, is Angirasi Vidya. The Marma points are 107 in numbers in our body. And somebody asked about that the Marma Chikitsa is acupressure or acupuncture or it is another thing. So always remember, keep in your mind that Marma Chikitsa is not an acupressure or acupuncture. Why? Actually, in our text it is mentioned that Maryanti iti Marmani means the area, the points where they get an injury and it is fatal, that is known as the Marma. You all know that Marma word is very commonly used in Sanskrit, the sensitive point. So the people thought about that this point is associated with some martial art techniques or saving ourselves from getting an injury. But in Veda, Atharva Veda, if you got a reference that the Angirasi Vidya, the Angirasi Vidya means that in which the person or the expert give a treatment or the transfer the energy through his own body. Means there is no use of medicine, no use of any procedure or invasion or any other type of maneuver. Only the touch and the energy is transferred to another person and the person got corrected. This is Marma Chikitsa. So you ask that why this Chikitsa is not practiced so frequently in northern region. In Kerala, I think that in Siddha also the people are practicing the Marma. But moreover, here the coloring is also in a martial art technique, which is also for self-defense. You all know. In the northern part, actually, when we asked the people who are practicing Marma here, who is your guru? They told us that the Agastya. The Agastya Sanhita is a very popular Sanhita in South India. And do you know that the Agastya is also a follower of Lord Shiva? All the actually all the origin of all the knowledge, the Vedic knowledge came from the Lord Shiva. Niranjanam Nirakara, Eko Devo Maheshwara. So God is only one. In all the religion, God is the supernatural power, superpower, and we all always one reference is there. Trayambakam Yajamahe Sugandhim Pushtivardhanam Urvarupavayogandana Mrityur Mukshe Mamrata. This also gives the importance of the liberation or the pain liberation, painless death. So 107 Marma points are there, and Marma points are the Angirasi Vidya. So anybody asked with that from you that where the Ayurveda, the Marma Chikitsa is mentioned. So you can say that the Ayurveda is also part of Atharvaveda. And the Atharvaveda, there are fourfold of treatment. One is the Angirasi, another one is the Devi, third one is the Manusya, and one is the Angirasi, Atharvani, Devi, and Manusya. Atharvani means if you are treating some patients by only giving counseling, that is the Atharvani. Devi is Panchabhautik Chikitsa, 5 basic elements. If there is some deficiency of 5 basic elements, you are giving the 5 basic elements. So that is Devi. Manusya is man-made treatment, in which surgery and other thing, everything comes. And the Angirasi is the Vidya in which you are giving the treatment by touching, by pressing, by stimulating certain points. So these Vedic knowledge is very ancient, so we can't compare it with the acupressure and acupuncture. The history of acupressure, acupuncture, and all the pathies comes very later on, the period of Buddha and the period of many other things. But the Sanatana Parampara or the Vedic Parampara is the oldest practice. So always keep that in your mind that this is our own practice. So Marma Chikitsa is our own practice. How many Verma points are there? 107. I will try to explain each and every points in the 2 day session, and I will try to demonstrate all the points in the body. So I ask one person also ready for exposing his body, and I will locate all the points. So it will be more practical demonstration. So I request in the coming sessions. Yeah. Yeah. So first of all, theoretically, I am explaining that the Verma points are 107 points. These are energy points. Why these are energy points? It is mentioned in text that the Mansa Sira Snayu Asti and Sandhi, and where the prana resides, that is the Marma points. Like the temple or mosque or the church where the God resides, we just fall our head and just give our just prayer to the God for getting blessings. Same way, the body is also a temple. It is mentioned that Iham sarira khalu dharma sadhanam. The body is the sadhana by which you follow the principles of the religion. And sarira vyadhi mandiram. It is also a temple of disease. So if you are not following the practices, following the marma stimulation, following the yogic practices, definitely we are suffering from different ailments. So marma chikitsa or marma vidya is not only for the patients, it is also for the maintaining the health and wellness. I will explain you how. So 107 marmas are there in body. 107 marmas. It is classified according to the nature of the marma. Some marma are fiery in nature, that is agni swabhava. Some are Somya Agni, means the water element and the fire element is balanced. I will explain everything. Some are only the water element is predominant in some Marma, and some Marma is Vayu and Agni Bhavu Pradhan. And some Marma are Vayu Bhavu. So long back, you got the history of the Marma science. You look some of the incidents. I will show you that how the Marma Chikitsa is associated with our ancient knowledge. So I am sharing some points there. It's like a PPT which you will enjoy. I hope that this PPT. So I'm just opening the notes. So this is a very important note. So you can, but notes are in Hindi. I will translate it in English, and so you write down it. Yeah. There is some actually network is not working properly. This is Ayush Darpan digital app. You can just go on the Class Plus app in which everything is there. You got all the notes and PDF and books there. Link. You just go to the login setup of the Class Plus. Class Plus is the app, and you just put the just look. I'm just opening this app. Yeah. Ayush Darpan digital. You just go in the Class Plus login setup, and you this window will comes, and in which just Class Plus, and there is a free study material section in which the notes of the Marma is present here. So Marma's different books is also present here in PDF form, and everything is here. So just I am sharing Class Plus app. Class Plus app. Every book, many of the books are here in Hindi, in English, in Sanskrit. The Ayurveda books you got, Sanskrit books you got from here. So I am just sharing this. Sushrut Sangeeta, you just find Panchakarma, Ayurvedic Panchakarma, Vijnana, Human Anatomy, textbook of Salak. Everything is we have uploaded. All the maximum of the books present, and the Vasant Lart's books, Marma Chikitsa, Chakradatta. You find all the books, essential Ayurvedic drugs, Chala Ketantra, Shem Kotuhal, Chikitsa Chandrodaya, Marma level 2 in English, Marma level 1. this is the notes which will share. I think that Dr. Vijay and their participants, I think some of the participants, and Sri Shubhida, this is from, they prepared this notes. So I will take the help of these notes. These are in English, so this will give you a proper knowledge and demonstration of the mark. So now this is a very simply mentioned in English. I think that what happens disconnected. So please, where is the technical person? I think that this is now disconnected. So marma is means Maryati Marmani, and the word is derived from the point when Mansasya, Asti, Sandhi mix. That point is known as marma and marma points. And Sannipatah Siras Snayu, Sandhi Mansa Sambhava, Marmani Teshu Tistantu, Prana Khalu Visisata. This is mentioned. Definitely you will find this. I think that there is some problem with this. Mansa Siras Snayu, Asti and Sandhi, where means and the prana resides, that is known as the marma points. So marma are classified accordingly as a Mansa marma, Sira marma, Snayu marma, Asti marma and Sandhi marma. Can it be a little more? Yeah. Mansa Sira Snayu, Sandhi Patah Sira Snayu, Sandhi Mansa Asti Sambhava, Marmanu Teshu Tistanti, Prana Khalu Viseshuta. दिख रहा है? Is it visible? The reference. The meeting point of vein, ligament, joint, muscles, bone is called marma. Why I am teaching all these things? Because when you know the practical, when you want to know the practical, first of all you have to know the theoretical concept. What is marma? So this is the marma. So history and concept of marma, if you look, what is the history? So if you look that there are many, I already explained you that marma are the center of the prana. Prana means the energy. Prana, if somebody having prana, the person is alive, and prana is not there, the person is dead. You all know. So prana is directly related with the marma. So marma is classified in Mansa, Sira, Snayu, Asti, Sandhi, and the prana resides on the point that is known as the marma. So 107 are the marma points. I will shortly just show you the classification of marma within 5 to 10 minutes, and then just come to the practical aspect of the marma, which is more important for you. Any of the participants who came from, who learned marma chikitsa from me through the online methods, and he has any confusion, they can ask about the points, whatever I will explain to them. So I'm just opening the notes, and the notes is in Hindi, so don't bother about Hindi. I will translate everything in English. So you find all these points very clearly. So there is, if you get the references of marma, so many of our ancient knowledge, like if you go to the Sri Krishna Himayasana, you find the history of getting injury in the Taladudai Marma, Pada Taladudai Marma. Himayasana of Lord Krishna. If you Natoham Kamaye Rajyam, Naswargam Nacha Punarbhavam, Kamaye Puttanam, Praninam Maratimasanam. This is the reference in which why you want to learn the Marma Chikitsa. Marma Chikitsa is a Chikitsa in which it doesn't cost anything. It is very cost effective. What it needs a marker and your knowledge of it. You can do it anywhere. So this is very cost effective treatment. So if you think that I will earn money from learning this knowledge, so actually this is a holistic approach. If you want to learn, then you have to keep this in your mind that this treatment is for a poor. But whoever wants to take this treatment, either is capable or not, he should be given the marma chikitsa. Okay? So this is the reference. You first have to follow this thing code of conduct before knowing the marma chikitsa. So I introduce myself. So I will fastly class everything. I will explain you, and theoretical part as well as practical part. So marma vigyan, I already explained you the classification. The Atharvani, the Angirasi, the Daivi, the Manusya. So marma chikitsa comes under the Angirasi vigyan. Sometimes I also ask questions with you, so so that will connect you. I think that AC is not working or काम नहीं कर रहा है क्या AC? मुझे गर्मी बहुत लग रही है. चलिए, मैं बाहर से आया हूँ ना. क्या आपको भी लग रही है? So all the marma points are very important. So marma points should be stimulated 5 to 8 times for a healthy person, and for a diseased person it should be stimulated 15 to 18 times. We are not giving pressure to any point. Always remember that is the basic difference between the acupressure and marma. We don't give pressure. What we do? Stimulation. How we will give stimulation? I will explain you. And always remember that never stimulate irrelevantly the marma points. There are certain marma points which are very important, very vital, very sensitive. Yeah. हिंदी में बताऊं? अच्छा, तो हिंदी इंग्लिश दोनों बताना पड़ेगा. तो मलयाली भी होंगे यहाँ पे. तो मर्मा जो है वो हमको सबको दबाना नहीं है. We don't have to stimulate. जब भी मर्जी आया तो मर्म दबा दिया, ऐसा नहीं करने का. Means you have there certain protocols. आपको प्रोटोकॉल फॉलो करना है कि ये नहीं कि कहीं पर भी दबा दिया मर्म, खड़े खड़े दबा दिया मर्म, चलते फिरते दबा दिया मर्म. Always there is a protocol. You have to follow the protocol. Code of conduct. इसको बोलते हैं ना, किसी भी चीज को सीखने के लिए उसका एक नियम होता है, कोड ऑफ कंडक्ट होता है. You all are comfortable with Hindi and English, I hope. Mix. Yeah, there are some people from North India also, so they are comfortable in Hindi. So, but notes Hindi में है ना आपके लिए, अच्छा है. So first of all, the Ravana. You know the Ravana. वैसे South India में रावण को बहुत ज्यादा बुरा नहीं मानते. इधर नजदीक में श्रीलंका है. तो रावण, the Ravana, you know that the नाभि मर्म, उनके नाभि मर्म पर आघात हुआ था. अभी तो रावण का demisal हुआ. तो all the energy is in the Manipur chakra, and that leads to the demisal of the Ravana. तो रावण की जो मृत्यु था वो भी नाभि मर्म पे आघात से हुआ था. Yeah, the Ravana demisal is also through the hit in the navi marma. Okay, whenever you got any confusion, you ask freely. Shravan Kumar is also a very obedient person. अपने माता पिता का बड़ा हाँ कर दीजिए थोड़ा सा. He is very obedient person, and sometimes his father and mother was blind, and I think that deepened up. And Dasratha hits on the Sthapni marma, and he got certain immediate death. And this is the Sthapni marma is also a Vishalyagna marma. When the foreign body goes inside and you just remove it immediately, then it leads to the Vata's removal, and immediately the patient will die. So it is. So there is a history. You Google करेंगे तो Jacob Miller is a army person, soldier, US soldier. The bullet 33 years, the bullet is inside. The splitter of the bullet was inside, and he was quite normal. If the bullet was removed, he may die immediately. So this is an example of the Vishalyagna. बीच में बताऊंगा आपको. So Philip Hughes, you know that the Australian cricketer, वो ऑस्ट्रेलिया क्रिकेटर था, और बॉल किधर लगी थी और उसकी मौत हो गई. And Raman Lamba is also a cricket player and got an injury in the Satya Pran Marma, and he dies immediately. आपको सब मालूम है. Now come to the point, classification of the marma. तो मांस मर्मा, शिरा मर्मा, स्नायु मर्मा, अस्थि मर्मा एंड संधि मर्मा. दिस इज द क्लासिफिकेशन. जैसे हम किसी मंदिर में या किसी घर में जाते हैं, होटल में आए, केरला लकड़ी के बहुत सारे देखा होगा अपने मंदिर में, बड़ा अच्छा बना हुआ रहता है. यहाँ पे पैगोडा सिपेट एंड आपको एक एंशिएंट लुक दिखता है ना. यहाँ का स्पेशलिटी है, देखा होगा आपने. आप बुद्धिज्म की उधर जाएंगे चाइना में, तो उधर भी आपको पैगोडा सिपेट मिलेगा. अब हमारे नॉर्थ में जाएंगे तो वहाँ मंदिर जो है ना, वो थोड़ा सा डोम मिलेगा उसके ऊपर. That is affected by the Mughals. Mughals के थोड़ा सा affected है, तो ये अपना अपना रहता है. तो जहाँ पे भगवान रहते हैं वहीं पूजा करते हैं. तो either he lives on the Mansa Marma, Sira Marma, Snayu Marma, Asti Marma, and Sandhi Marma. What is the importance of this knowledge? So when I explain that this Marma is Mansa Marma, you understand what pressure we have to give. When I explain you the Sira Marma, then you understand what pressure we have to give. When you understand this is Snayu Marma, you understand what pressure we have to give. तो हमको जब इसका क्लासिफिकेशन पता होगा तो हमको समझ में आया कितना दबाव देना है, कहाँ ज्यादा देना है, कहाँ कम देना है, तो इसलिए हम आपको ये बताएंगे. तो 11 are Mans Marma, 41 are Sira Marma, and 27 are Snayu Marma, and the same Asti Marma are 8, and Sandhi Marma is total 107 the Marma, 20 Sandhi Marma. According to the fatality, Sadhya Prana, आप सब आयुर्वेद से पढ़ के आए हैं. You all know about the Sadhya Prana Har Marma, Kalantar Prana Har Marma, and Vishalan Marma, Vaikalikar Marma, as well as the Rudrakar Marma. So just come to the next slide. So I am just coming. Mans Marma. Mans Marma. Tatra Tal Hriday Indravasti. Godastana Rohita Mans Marman. मेघना जी का नाम मेघना है, देखिए कितना बढ़िया नाम. नहीं, आपका परिचय नहीं हुआ आप लोगों का. विजय जी's name is Vijay, and some everybody is known by his or her name, and every name repeats the meaning है ना उसका पीछे. अब मर्मा, you are telling that मर्मा मारयंती थी मर्मा, but then you look the name Tal Hriday. Why the name Tal Hriday is given? Anybody can explain? Might दे देते हैं ना आपको. Tal Hriday, the name of Marma is Tal Hriday. Why? It is Mariyanti thi Marma, then why the name Tal Hriday? The question arises. दिमाग में आता होगा सवाल ना आपके. The name of the Marma is Tal Hriday. The Marma is defined as the Mariyanti thi Marma. The points where we get the injury, it is fatal. But the name is Tal Hriday. Why the name Tal Hriday? Means there is a connection with the heart. Definitely, the name itself indicates the connection with the heart. Meghna ji ka naam Meghna hai. Meghna, cloud definitely is connected with the rain or cloud. Same way Indravasti. The second name is Indravasti. Why the name Indravasti? Basti is a word associated with the bladder. And Indra is the god of rain. Means that something relation with the urinary bladder, or we can say that ureter and kidney. There is a relation, but we can't find this relation in any of the Ayurveda texts. Always it is mentioned that it's fatal for if you give an injury to intravenously, then blood loss will there and patient will die after some time, or whatever there is mentioned about the death. So when we explain about the death and everything about death, and why we will use that point? When you explain that this point is dangerous, this point is fatal, and this is associated with death, why you will touch this point? So what happens that everything there are two aspects. One is positive, another is the negative aspect. So you all know that the negative aspect is always highlighted. Positive aspect always come very slowly. अच्छाई बहुत धीमे-धीमे जाता है, बुराई तुरंत जाता है आगे. नहीं, negative things flourish immediately. And what happens? The Ayurveda fellows practice the Marma very sacredly. No, I don't. It's a very sacred thing. So Gupta Vidya, sacred practice. So Guru just give this knowledge, transfer this knowledge to Shishya. And he told that there are so many protocols you have to follow. So if you don't want to propagate something, what you do, you just make things complicated. Oh, so many things needed. Like before the Swami Ramdev, the yoga is also restricted to now Swami Ramdev. What he do? He just did Anulom Vilom Kapalabhati, very common for people. So that's why now the yoga is popularized. Yoga is already present thousands of years back. Patanjali is the main originator of the yoga. But branding and propagation is done by Swami Ramdev. Simply, the Marma, we don't popularize it. We always associate it with the death, fatality, so nobody wants to learn. So I will explain you how the Marma is beneficial. So I request all of you, if you have any people local from Kerala, you bring some patients also, like frozen shoulder. I will show you how the patient got relief in one single sort of treatment. So these are the Mans Marma and Sira Marma. same the Snayu Marma, Asti Marma, and Sandhi Marma. I will not go to the details. Just I am coming to the practical part of the Marma. First, I will start the Marma points from the head region. So now, start the head Marma points. So I am just skipping all the notes here. If you are taking interest, I will send you the notes. These are notes are already available in the Ayush Darpan Digital's app. So all the marmas has been explained as a pramana. Yeah. Pramana. It is explained that there is a size of marma. Some marmas are half angula pramana, means small size. Some are 2 angula pramana. Some are 4 angula pramana, and some are 3 angula pramana. Angula pramana means the location of the marma. समझ में आ रहा है? कुछ आधे अंगुल के हैं, कुछ 2 अंगुल के हैं, कुछ 3 अंगुल के हैं, कुछ 4 अंगुल के हैं. जैसे आप बैठे ना, तो आप थोड़ा सा ज्यादा बैठे हैं, ये थोड़ा कम बैठे हैं, ये मैडम और कम बैठी है, ये सर देखो इतना एरिया ऑक्यूपाई किए, ये सर कुछ और एरिया ऑक्यूपाई किए. साइज ऑफ द ऑक्यूपाइड एरिया, बट द क्लिनिकल इफेक्ट इज नॉट बाउंडेड टू दैट ऑक्यूपाइड एरिया. वो बहुत बड़े एरिया में है. तो आई विल एक्सप्लेन इट. सो उर्वी, कूर्चसिर, विटप and Kakshadhar, these marma are 4 angul, 1 angula pramana. Means 1 angula pramana means this is the area. This is the area. Anybody has any doubt, they can ask the questions very easily. You can ask. No hesitation. If you are not understanding in Hindi, English or any, yeah.
तो एक-एक आदमी का अंगुली अलग-अलग होता है.
हाँ, very good question. बहुत अच्छा सवाल पूछा है. मैंने पूछा कि what is the definition of the angula pramana? So it is mentioned that you have to take the angular pramana from the size of the patient. If the small size patient, you are taking the size of the small child, then you have to take angular pramana from the patient size. Are you understanding? You are getting? You are getting? Everything is clear? So Urvi, Kuchasir, Vitap and Kakshadhar are 1 angular pramana. In the same way, the Manibandha, Wolf and Stanamul are 2 angula pramana. Thank you. Very further. Or the Janu and Kurpar are 3 angula pramana. Janu and Kurpar are 3 angula pramana. 3 is not taken 3 as this. This 3 is taken as this size. Yeah, circumference 3 angula pramana. Means on an average you can say that there are small size marma, middle size marma, and big size marma, and maximum size is 4 angula pramana. Clear? समझ में आ रहा है? Now come, this is the clinical aspect of the point, and now I come to the practical aspect. So total number of marma are 107 in number. 37 is located above the neck. 11 in each extremities. Total 44. And 9 plus 3, 12 is in chest and abdomen, and 14 in the back side. So how many number of marma? 107. It is not 108, not 1099, not 1010. One person from Ayurveda called me and told that Guruji, I have discovered 33 marma points. I saluted him and told him that now you are more than Lord Shiva. आप भगवान शिव से भी ज़्यादा हो गई है. 107 है तो 107 ही है. You can't add or subtract. Always remember that. So this is the number of marma points. Now I am not going to the classification of this marma. I am just going to the now practical aspect of the marma. So now I am just starting the points, starting from the head marma. So I request one of the person who is just coming on the front side, might nearby to me, and I will show you the marma. First one marma, one आएगा इधर. अरे कोई आ जाओ. Dr. Vijay. So always remember that before learning the marma, there is a protocol. एक प्रोटोकॉल होता है सीखने का. ठीक है? क्या प्रोटोकॉल होता है कि फर्स्ट ऑफ ऑल the marma practitioner should firm believe on marma. If you don't believe on marma, then you will not get results. Number one, you are in the upper side. You are giving the energy. आप energy दे रहे हैं, दूसरा ले रहा है. तो पैसा देने वाला ज्यादा धनी होना चाहिए ना, लेने वाला गरीब होना चाहिए. Always बैंक में पैसा होना चाहिए. Bank should be use amount of cash, and the loan taking person should always be in a negative. So the marma chikitsa who is giving, he should be a very higher in energy level. If you are in lower energy level side, then definitely you will not get the results, and there is chances that you will get the negative energy from the patients. So first thing is that one should practice yoga and one should practice the swamarma chikitsa. I will explain. First, second thing is marma never stimulation is never given in standing position. So I am just giving demonstration. So never do marma stimulation in standing position. Now, right? Just note down it. This is very important. It should be done in sitting position or lying down position. बिठा के करना है या लिटा के करना है. ठीक है, कुर्सी ले आइए. Third thing is that never do marma stimulation. How many people are from the nearby the tissue? So raise your hand. How many? 1, 2, 3, 4, 5, 6. Okay. And how many from Telangana? Telangana, 1. And other, you are all from Karnataka. Okay, Jadhav. Where is Jadhav, sir? अरे आप आगे आओ ना जी. And Professor Jadhav is also another. Jadhav sir is also here. Chuchuka Jadhav. Very welcome. Jadhav, go ahead. So you all are comfortable in English and Hindi? Yeah. Okay, no problem. So never do marma stimulation in standing position. Never do marma stimulation in a pregnant lady. Note down it. गलती मत करना. बैठ जाइए. marma stimulation नहीं करने का. कब नहीं करने का? स्टैंडिंग में नहीं करने का. कब नहीं करने का? प्रेग्नेंट में नहीं करने का. अब पूछोगे क्यों नहीं करने का? Why we avoid? Question also arises ना. So you have told that no, don't do the marma stimulation pregnancy. In Shushu Samhita, it is mentioned that the pregnant lady is Dovrida, and there is a garbhopaghatkar bhav. If you are stimulating talhridaya marma of a pregnant lady, you are indirectly giving stimulation to the child's talhridaya marma. That is not required. So there may be chances of birth deformity. So that's why Sushruta mentioned what? Garbhopaghatkar bhav. So you have to avoid. So there is no such research. So you have no right to stimulate the pregnant lady marma points. So remember this. Third thing is that. आ रहा है समझ में? क्यों नहीं करने का? And avoid marma stimulation in a female during the menstruation cycle day, because the female is in lower side of energy, so already in stressful condition, we have no right to give more stress to female. So always avoid. And fourth thing is that I already explained that if you are in lower side of energy and the patient, जैसे मैं आपका कर रहा हूँ, अब आप बड़े स्वस्थ हो, मैं ही बीमार हूँ, और मैं डॉक्टर हूँ, I am a doctor, you came in for treatment, पर मैं खुद ही बीमार हूँ, तो what is the chances? मैं आपका एनर्जी मेरे को मिल जाएगा. So in many cases what happens after marma stimulation, Jadhav sir, the doctor feels lower energy, headache, so many problems. Oh, I will not do. ये तो बेकार है. काय को बेकार है? Why this is not working? काय को नहीं है? क्योंकि आप खुद ही बीमार हो. So you are at the taker side and he is now at the giver side. तो लेने वाला हमेशा नीचे होना चाहिए, देने वाला ऊपर होना चाहिए. मैं जैसे मैं आपको ज्ञान दे रहा हूँ तो मैं इधर, आप उधर बैठे हो, और मैं आपसे उधर से लेने लग जाऊँ तो मेरा क्या मतलब है? तो ये है. Fourth thing is, sometimes if you feel that in your OPD you are doing regular marma practice and it happens that sometimes you feel certain negative energy, so you put rudraksh on your finger. This is mentioned in protocol. You have to put Rudraksh in your. Rudraksh is a, you know that it is a plant and seed which absorbs the negative energy. It is scientifically proven. Okay, 107 Marma points. Never do Marma stimulation in stagnant position. Never do Marma points stimulation in pregnancy. Never do Marma points. Avoid the Marma point stimulation during the menstrual period, and also carefully stimulate the Marma point in child and elderly people. बच्चे में और elderly people. And already somebody asked that what is the angula pramana of Marma? I think that sir has asked. Those this taken size should be taken with the size of the person. चलिए अब start करते हैं. Head से start करते हैं, सिर से start करते हैं. Yeah. Rudraksh. I think that there are so many myths that एक मुखी Rudraksh, पंचमुखी. You can take any Rudraksh. No any specification. अब हम स्टार्ट करते हैं मर्म ऑफ द हेड. अभी हाँ अभी आएगा अभी आएगा वीडियो आएगा. इधर आइए स्टेट में आइए स्टेट. आप इधर आइए इधर ऊपर आइए. लाइट फोकस. अभी आप लाइट जला दीजिए पीछे का. लाइट फोकस. इधर का लाइट जला दीजिए. इधर का लाइट जला दीजिए. हाँ अब हम इधर से आएंगे. ये आपको इधर भी दिखेगा. और तो ऑन कर दीजिए. बैठिए. तो सबसे पहले हम राजा. We will body is a country. In the Gita it is mentioned that kshetra, sharir is kshetra, and the atma is kshetragya. So you can understand that body is a country and the sira is uttamang. You know uttamang capital. तो capital में कौन रहता है? Who is residing in the capital? Residing in the capital, top post. बोलो ना अरे Prime Minister Modi. Okay, so nowadays अब तो राजतंत्र खत्म हो गया. Now there is no king. Now the democracy is there. So Prime Minister is the. I think that it is nearby to the king. No, Adhipati. Adhipati means which rules. Adhipati. हाँ Adhipati. Adhipati. सबका पति. Means controller of the body. So controller always in the top side. So it resides in the top of the vertex. कहाँ पे top of the vertex? This is a center. It is known as a torcular hairophylla. I'm just showing you one. ये इधर घुमाएंगे थोड़ा सा. आपको दिखाएंगे ना ऐसे. ये दिख रहा है? देखो ये थोड़ा ऊपर. This is the torcular hairophylla. जहाँ पे भंवर होते हैं. The tuft of the hair. This is the Adhipati. Adhipati is already Adhipati means king. Means it is always that when the power comes, it's also come with arrogance. Power है ना, सत्ता का नशा. नहीं बोलते. Power. If you give a wrong tweet to the Modi's Twitter handle, what happens? You just check it. अगर आप कुछ भी गलत लिखोगे तो तुरंत कार्रवाई हो जाएगी. पावर है ना. तो ये इधर भी the Prime Minister, when you talk with your Chief Minister's office, you have to take an appointment. Clear? ऐसे ही जा सकते हैं आप. सुबह भी चलेंगे, शाम भी चलेंगे. You have to take appointment and you have to put application. What is the purpose of visit? So the same thing, this Adhipati Marma you have to, if you want to approach this point, you have to take appointment, and the appointment time is two. One is Brahma Muhurta and another one is the Trikala Sandhya. दो टाइम जा सकते हो आप, सुबह और त्रिकाल. आप पूछोगे why? No, I will go in the midnight. भगवान के मंदिर में भी, I think that in Kerala also, God sleep in daytime. They also sleep on the night time. Temple also close. नहीं? मंदिर में बंद हो जाता है ना सर? होता है कि नहीं होता है? चल खुला तो नहीं रहता है, होता है ना बंद. आपको ट्राई कर लेना, आप इस मर्मा को रात के 12 बजे स्टिमुलेट करके देख लेना. आपको नुकसान नहीं हो गया तो मेरा नाम आप बता देना कि भाई नवीन जोशी का इसको बेकार बताते हैं. Always keep in this mind. This is a very vital point. This is known as Sahasrara Chakra, Sahasrara Chakra, or Brahma Randra. It connects you with the superpower, the God. So always this Sadhya Pranadharma. Ardha Angula Pramana. You can write down in your notes. I will share the notes also, but in this class I will show you practical. So it will be more interesting for you. So this is the Ardha Angula Pramana, means Ardha Angula. So this is the circumference of this point. So today nowadays I just explained to my students that you can put some Siro Pichu over here. In Kerala also you know that Pichu Dharana is also done here. So actually this is the Brahmaranga. But always remember that never Agneya Dravya is not put it over here. Because this is already a Agneya Marma. All the Satya Pranadhara Marma are Agneya in nature. So always know that in our ancient or in the rituals also, when we remove the hair, we just leave the some hair over here. यहाँ पे छोड़ देंगे ना बाल. In females also they चोटी बनाते हैं, देखा होगा आपको. So this is the point. So this is the Adhipati Marma. So Adhipati Marma is a Sandhi Marma. Why? So this is a sagittal suture. This is the coronal suture, and this is the lambdoidal suture. So it is at the junction of the sagittal and lambdoidal suture. I will draw the diagram and I will show you. This is the lambdoidal suture. This is the sagittal suture. So this is the point where lambdoidal suture connects with the sagittal suture. तो कैसा मर्मा है? संधि मर्मा. संधि मर्मा. संधि मर्मा. Half angle pramana. Agneya in Swabhava. So Agneya in Swabhava means always you have to take proper appointment and proper stimulation. I already explained that for a healthy person you have to give 5 to 8 stimulation. So how you have to give a stimulation? So Vijay ji, you know that you have to make your 5 fingers in this way. Just put your 5 fingers. Represents 5 things. Yeah, this is the yes. Show it. I think that now it is good, visible. This is the thumb. It represents the Agni Mahabhut. अंगूठा दिखाते हैं ना ऐसे ऐसे. Thumbs up. तो Agni. This is small finger represents the Jala Mahabhut. ऐसे जाना है बोलते हैं ना. देखो कनेक्शन है उसका. The ring finger represents the Prithvi Mahabhut, in which we wear the rings. And the middle finger represents the Akash Mahabhut, and index finger represents the Vayu Mahabhut. So all the 5 Mahabhut, just you have to fold your fingers and you have to just keep on the top of the vertex like this. Yes, one like this. And how you have to stimulate? You have to press it, release it. Press it, release it. You have not to ऊपर नहीं करना है, ऐसा नहीं करना है, ऐसा नहीं करना है. कैसे करना है? थोड़े प्यार से press it, release it. करिए, just do it. अभी तो टाइम नहीं है, वैसे गलत टाइम है, पर फिर भी सिखाने के लिए चलेगा. मैं आपका देखता हूँ गलत तो नहीं कर रहे, यही तो यहाँ पे फायदा है. Yes, yes, very nice, very nice, very nice. Good. पीछे तक आएंगे हम. जी ज्यादा साफ. ओ मैडम यहाँ पे करिए मैडम, कोई प्रॉब्लम नहीं. अर्धांगुल प्रमाण संधि मर्म, आग्नेय नेचर, हाँ हाफ अंगुल प्रमाण, संधि मर्म, आग्नेय नेचर, सत्य प्राण हर्मन। तो सर आप सत्य प्राण हर्मन बोल रहे हो और उसको दबाव कह रहे हो, ऐसे ऐसा करो बोल रहे हो, तो क्या फायदा है इसका? What is the benefit? So benefit of this marma, as it is adhipati, it has action over whole of the body. So you can write down it. Nadi tantra, nadi, nerves. Know that the pituitary gland is just give a stimulation to the pituitary gland, which is known as the band orchestra. You find band master. Sorry, I know Parkinsonism. So many patients. Parkinsonism. If you see results, so बहुत अच्छा stimulate मर्मा and ब्रह्म मुहूर्त and trikalasa. Yeah, thyroid also. But always remember that never stimulate this murmur in midnight. Never remember. कभी नहीं करेगा. Yeah, trikalasa, yes. So it has an effect as Prime Minister has a power to Kashmir to Kanyakumari. In the same way, this murmur has an effect on the whole of the body. So any doubt? Yeah, you can ask. Trikala Sandhya is the evening time when Godhuli is there and we pay already in the temple also. हम लोग पूजा करते हैं उधर, देखा होगा आपने. सांध्या पूजा का काल जो होता है, that is the Trikala Sandhya. उसको बोलते हैं तीन काल जुड़ते हैं उसमें. तो उस समय में ना रिलैक्स होते कहते हैं. जैसे सुबह सो के उठेगा ना आदमी. If you take a proper sleep in night and awake in morning, you will fresh. तो टाइम अगर कोई गुस्सा करके भी आएगा ना, अरे सुबह आया छोड़ो यार, क्या से लगना है नहीं, तो same time the mood is fresh. So marma point is also gave the same light. So always remember that this marma should be practiced, stimulated. Always remember that marma should not be pressed. दबाना नहीं है ना, दबा के किसी से काम करा लेते हो क्या आप? By pressure you can't do any work in your working area also. You have to always प्यार से चिकनी चुपड़ी बात करके. So that's why we just give massage over this point, we put oil over this point, we give tissue over this point. So these points will affect. So Panchakarma also, when we are doing zero tissue, where the Ramesh Das Guruji, तो वो भी हमारे मर्मा से ही काम करता है. That is the Adhipati. So now it is clear where the Adhipati Marma. One Marma location is clear, identification is clear, the clinical importance is clear. So now come to the next point. Yeah, you ask. Yes, you can practice, but not in the neonate में नहीं करना. अब जैसे कि ये मैडम का है तो इसको हल्के हल्के कर सकते हैं. लेकिन जो अभी बच्चा पैदा हुआ है, the child is just born, you know that sutures are not fused properly, so don't stimulate this one. So neonatal में नहीं करने का, ठीक है ना? 5 years, 3 to 5 years, 3, 4 or 5 years. Now come to the next one point. देखिए कितना बढ़िया है. राजा अकेले रहता है क्या? मोदी अकेले है क्या? Prime Minister itself works, or he needs some top ministers. In your state also, the state minister is there, and I think all the cabinet minister is also there. The same way, in the body also, this Adhipati needs also 5 cabinet ministers. So these are known as Simanta. कैसे जानेंगे सीमंत? तो सीमंत हम बताएंगे आपको. सीमंत is known as जोड़ना, connect. Cement is also a word, you know. In English, cementing means adding, जोड़ना. In the same way, the 5 points are there. They are known as सीमंत. आइए अब जानते हैं. अधिपति आ गया समझ में? एकदम clear, it is clear. In Hindi, English, whatever language you want, I will explain. Now you know that this is the coronal suture. Corona is very famous. So coronal suture. Coronal suture connects from this part to this part. Means the frontal bone, it just divides coronal suture. The parietal bone is divided by the sagittal suture, and back side occipital bone is divided by the lambdoidal suture. Adipati marma is situated junction between the lambdoidal and sagittal. But in the coronal suture, there is 2 points. One is here, one is here. One is here, one is here. देख लो अभी खोपड़ी में बताएंगे, अभी बताऊंगा आगे भी. Another point is just at the front side, just immediately at the front of the adhipati. How many points? 1, 2, 3. 5 बोला ना, 5 है. 2 किधर है? 2 आर पीछे घूम जाएंगे आप. Just कुर्सी घुमा लो. पीछे से भी दिखाए. 2. This is the lambdoidal suture. So 2 is situated at just back. How many points? 5. 2 at the coronal, 1 is at the sagittal, and 2 is at the lambdoidal suture. तो ये पांचों सर्कस देखिए तो सराउंड कर रहे हैं किसको? अधिपति को. कर रहे हैं कि नहीं कर रहे हैं? घूम जाओ सामने. 5 मर्म. सीमंत. The name itself indicates that the Simanta is not Satya Pranahara. It is Kalantar Pranahara. It is also Sandhi Marma. It is Soumya Agneya, Jal and Agni Mahabhut. आपके इधर मर्म सिखाते होंगे, मैं कमेंट नहीं कर रहा हूँ. केरला में मर्म का ये तो पूरा मर्म बहुत है, पर आपने यहाँ भी मर्म देखा होगा. ये जो मैं भी आपको नॉलेज दे रहा हूँ, whatever knowledge I am transferring to you, this is the Ayurvedic knowledge, Vedic knowledge, and all the references came through the small books like Durga Saptati, the different Atharvaveda quotations. वहाँ से आया है. And Charak Samhita is also mentioned that मर्म अनुपालयति, अपने मर्म का अनुपालन करना चाहिए, अच्छा रखना चाहिए, healthy रखना चाहिए. You must have to stimulate it. So this is Simanta. So how we approach this one? This is 4 अंगुल प्रमाण, 4 अंगुल प्रमाण. लिख लीजिए. ये जो knowledge आपको मैं दे रहा हूँ इधर आसानी से मिल रहा है. You are getting very easily, but this knowledge takes 20 to 22 days. In each day I am taking lectures and online. So Vijay ji also got some knowledge about this point, so that's why. कैसे करेंगे इसको? तो जब आपको टेंशन होती है तो क्या करते हैं आप? सिर पकड़ के बैठ जाते हैं. हाय राम करते हैं ना. तो विजय जी जरा हाय राम करके दिखाओ. सब पकड़ लिया हमने. हम हाय राम करते हैं ना, when we do हाय राम हो इसका ऐसे नहीं करते थे. देखो ये कहाँ रख रहे हैं पॉइंट, करो. So just look, when we are doing such positions, what is going on? 1, 2, 3, 4. 4 fingers are connecting with this slightly straight रखो. Or this should be at the back. See, ये देखो. This is the way. So you are connecting with the coronal sutures point, the front of the sagittal sutures point, as well as the lambdoidal. You do it. I will check it. करिए आप सब. सिमत करिए. तभी तो देखेंगे. करिए. Yes. Thumb should be at back. Yes. Yes. Very nice. Yes. This is the coronal, this is the sagittal, this is the lambdoid. Coronal, sagittal, lambdoid. Yes. Coronal, sagittal, lambdoid. बहुत ज़्यादा गैप हो गया थोड़ा बहुत. हाँ. Fingers पीछे चला गया. Yes. Yes. So what you have to do? You have to give pressure. Press. प्रेस कीजिए. प्रेस दबाइए ऊपर. और इसके इधर अंगूठा भी दबेगा. इधर ये अंगूठा भी दबेगा. पीछे वाला भी दबेगा. हाँ. बैक साइड भी. यस. देखिए कितना मजा आ रहा है. अभी 5 बार करके देखिए आप. Just do it and tell. कुछ हुआ? मजा आ रहा है? अभी कुछ नहीं आएगा. सुबह करना सुबह. Morning. Simanta are 5 in number. And Adipati and then Simanta. 5 number Kalatar Pradhar Marma, and same clinical properties as of the Adipati. They helps Adipati for doing his work. So it is also an effect of the whole body, nervous system, pranavayu, endocrine system, and also very beneficial for patients who are suffering from Parkinsonism. Parkinsonism में कराना भैया देख लेना, बहुत फायदा मिलता है. The senior citizens who are suffering from genetic problems like भूल जाते हैं ना, याद नहीं रहता, memory loss, insomnia, very effective. आप करके देखो सुबह, अभी तो टाइम गलत है. This is the mid-noon time. I think that is a good time to do such marma. Adhipati and Seman especially. It is Somya and Agni means Jala and Agni Mahabhut Pradhan Marma, 4 Angula Pramana and Sandhi Marma. So you can do it, but you avoid this marma stimulation in neonates term 2. So this is the Seman. पता चल गया? Everything is clear about this point? How you can stimulate? Anything, any doubt you can ask by raising your hand. I will clarify you. Yeah. Seman. Semanto nayan samskar. Seman. Clear? Same time. For a healthy person, you have to stimulate 5 to 8 times. And for diseased person, you have to stimulate 15 to 18 times. So you have to stimulate 15 to 18 times. So this is the Seman marma. So now come to the next marma point. क्या क्या हो गया? कितने marma हो गए? How many? 6. So now you know that the governments also have an eye on the what is going on in the public, like the information system, who is taking inputs from public also and give messages to the Adipati, to the king, to the prime minister or chief minister. In the same way, there is a Vidhur Marma. Very clearly it is shown in this video. So this is the, you know, this is the, you visualizing this? This is the mastoid process. This is the mastoid process. This is the Vidhur. So how you, Vidhur Marma is a Snayu Marma. You can write down it. It is 2 in number. Vidhur, Vidhur, V-I-T-H-U-R, Vidhur. It is 2 in number. It is Snayu Marma, Ardha Angul Pramana, and all the. It is Somya in nature. Somya. Somya means Jala Mahabhut Pradhan. Agni means Agni Mahabhut Pradhan. Somya Agni means Agni and Jala Mahabhut Pradhan. Vayu means Vayu Mahabhut Pradhan. So this is a Snayu Marma, Ardha Angula Pramana. Somya means Jala Mahabhut Pradhan Marma, and all the Somya Marma are Vaikalyakar. Vaikalyakar means disability causing. If you can give an injury to this point, the patient will permanently deaf. In Kerala coloring person, I just last year I met with some coloring last. I think that your master, bone setting master. I asked about the coloring. So he shows me this point that by giving an injury to this point, क्या किया उसने? इधर से कोई हथियार लेके आया. Somebody is coming with some arm or some hitting instrument. What do you do? इधर खड़े हो जाओगे. बताया मेरे को कि हम ये point करते हैं. But he told me that I hit this point like this, and the patient will got this. तो क्या किया? इधर विधुर मर्म पे on person disbalance, what happens? Just for, so this he explained. He's explaining this is the art. This is the art. I don't know. I am not knowing that coloring, but I hope that many people from this side they know about more about this. But this is Vidhur Marma. This is the Vidhur Marma. So Vidhur is for the auditory functions. 2 nadis are passing through this marma. One is the Payaswari, and another one is the Sankhini. Payaswari and Sankhini. So this marma point is responsible for the auditory functions. Sunna. Sunai dena chahiye na raja ko acha. The king also know good information system, auditory information system. So this is Marma point related with the balance. And how we stimulate this point? Simply just just you have to put both thumb over this point. Both thumbs. Yes. 1 minute. Yes. Yes. And you have to just upward, press it, release it. Upward how? Press, release. Press it, release it. Press it, release it. Press it, release it. 5 to 8 times. This is the विधुर. समझ में आ रहा? तो पहले अधिपति किया, फिर सीमंत किया, फिर विधुर किया. First we yeah. Match to process. This is when you just do upward ना, just ध्यान से सुनिएगा. You heard a click sound, just click like a plastic is just crackling. अभी तो बहुत लोग बैठे हैं. When you morning time, when you just do it like this, click.
Open your hands.
हल्का सा click. Yeah, this, yes, I will just do it.
No.
And down. Menstruate process. ठीक है? Clear है पीछे में? डॉक्टर साहब? This is Swami Marma. All Swami Marma are very related. Remember, all आगे Marma are सत्य प्राण है. Always. मैं आपको याद दिला दूँ, याद करा दूँगा Marma. आप चिंता मत करो. इधर से जाओगे तो Marma प्रैक्टिस करोगे आप. ठीक है? हाँ. ये ऑडिटरी सुनाई कम दे, सुनते कम है, कई बच्चे सुनते नहीं है. कान में आवाज आती है, टिनिटस है ना, घों की आवाज आती है, घंटियां बजती है. कई बार देखा होगा आपने. कभी-कभी बैलेंसिंग में प्रॉब्लम आती है. Sometimes the balancing is not proper. In that condition, you can stimulate this point. Vertigo, yes. For vertigo, tinnitus, in such cases, you can stimulate this point. So this is a very important and very good point. Trigeminal neuralgia, yes, but there are sequence of marmas. I will explain you which marma you have to stimulate in certain clinical conditions. But in tomorrow's lecture, when you understand about all the points, so that's why I am telling you you have to take all the lectures very clearly. If you miss some points, some part, then you can't understand about the sequence of marma. Last lecture I will explain you in which disease you stimulate this marma. Timing for this marma? This marma can be stimulated at any time because this is soumya marma. You can't do anything. You pranam करके ऐसे खड़े रहते हैं ना, तो झापड़ मार के भी चला जाता है कोई. जब मोदी जी को करके दिखाओ ना, अब ये तो बेचारा ऐसे खड़ा है ना, चल महाभूत प्रधान marma. What if you hit? क्या करेगा? टेढ़ा बना देगा, मारेगा नहीं आपको. So that's why it is vehicle later. So that's why I am explaining all Jal Mahabhut Pradhan Marma are not surface. They are vehicle later. बहरा बना देगा, जिंदा तो रहेगा ही आदमी ना. The person will alive, but auditory sensation will gone. One thing I want to note down it, all the marmas, if you give injury to the point, what fatal effect you observe, the reciprocity same effect you find when you stimulate. Opposite effect. If some marma is explained that it is just hearing loss it creates when you give an injury, you observe that when you stimulate this point, it creates the hearing improvement. So this is a very beautiful thing with associated with marma. मतलब आप किसी को प्यार से काम करोगे, means you give some proper respect to some person, then you find great response from that. Or annoying some person, then you find same opposite result from that person, same for the marma process. So this is the vidhur. Clear? Vidhur is at the mastoid process, behind the pinna, ardhangul pramana, snayu marma, soumya in nature, vehicle later, having an effect on auditory sensation. Clear? Anybody has any doubt? कोई शंका हो तो पूछ लेना. Doubt लेके मत जाना. नहीं तो how many days? Yes, a very common question people ask at कब तक करना है? देखो ऐसा है, there are two aspects of Marma points, Dr. Saab. One aspect is for health and fitness. If you want to take care about your auditory system, so you have to stimulate regularly at morning time 5 to 8 times. But if some person is suffering from some auditory problems, then you have to stimulate according to the condition of the disease, but 2 times, 15 to 18. And what is the duration of the stimulation? This is a very basic question you don't ask. 0.8 seconds. One stimulation, press and release, like just do it. Press and release, press and release, press release, press release, press release, press release, press release, press release, 0.8 seconds. Why 0.8 seconds? One cardiac cycle is of 0.8 seconds. So, ये भी एक बहुत जबरदस्त बात है. Om Namah Shivaya mantra is also taking 0.8 seconds. 0.8 seconds. So always remember this. So this is the Vidhur Marma. So Vidhur Marma is now clear. So Vidhur Marma is good for auditory functions. सुनने के लिए. समझ रहे हैं सर? Radio station है. This is the Akashvani, Prasar Bharati of the government. So this is the Prasar Bharati of our body. Adhipati Marma. Now come to the next one point, that is the Sankha. Sankha. Sankha is also known as temple reason. Temple. Bhruvo antaro rupari karna lalato madhye sankho. कहते हैं भौं के अंत में और कान in the at the end of the eyebrow. इधर घूमना पड़ेगा ऐसा घूमना पड़ेगा. Yes. Yes. Now it's clear. This is the end of the उधर से उल्टा. ऐसा उधर या फिर ऐसा ऐसा हाँ और इधर ठीक है ऐसे घूमना. ठीक है पहले सही बैठा और इधर हाँ और इधर ऐसे सीधा बैठ जाओ. हाँ now it's so this is I think that this side something. हाँ this is the end of क्या हो रहा है हाँ ये है तो हमको इधर से दिखाना पड़ेगा. इधर दिखाना पड़ेगा. Yes yes now it's so this is the end of the eyebrow. Okay. Bhruvo antar rupari karna lalato madhye. This is the karna lalat madhye and the center. This is the point. Just put your finger, index finger, end of the eyebrow. Draw a imaginary line between the end of the eyebrow and the karna lalat. This is the center. अपने भौं के अंत में. Yes, this is the center. Yes, this is the center. You just feel a pulsation over this point. Are you feeling pulsation? Simply भ्रुवो अंतर रूपरी कर्ण ललाटो मध्य. भ्रुवो अंतर रूपरी कर्ण ललाटे मध्य. ये जो आपने वो आगे रखेगा ये सेंटर पे. ये कहाँ रखना है सर आप? गुड. भ्रुवो अंतर रूपरी कर्ण ललाटे मध्य. अब यहाँ पे सिखा के जाएंगे आप कर पाएंगे. आगे सर पल्सेशन मिल रहा है. इधर दिखाओ बहुत थोड़ा पीछे चला गया. सेंटर सर पीछे नहीं सेंटर मैडम बहुत सेंटर करे सेंटर. ध्रुवो अंतरो इंडेक्स फिंगर सेंटर. अर्धांगुल प्रमाण. No, not with thumb. This index finger, index, not go with thumb. Index. This finger, yes. Pulse, Sankha. Yeah. Dhruvo antaro rupari karna lalato madhye sankho tatra sadyo maranam. It is a Agneya Marma. Sadya Pranharma. Dhruvo antaro rupari karna lalato madhye. No. Center between the end of the eyebrow as well as the karnapali. Center. Okay. Clear? Is there any doubt in the location? You know, Dhruvo antaro rupari. Yeah, you feel the pulsation of this one. This is known as Sankha. Do you know that in your practice also when you got a headache, You already place your finger over this point and just pressing this point. Sankha. Just look at the beauty of this point. Actually, this is a sankha. Sankha is a word for temple region. No? Temple is very sensitive word. Yeah? काय के लिए है? अभी बताएंगे ना काय के लिए है? अभी बताएंगे. Sankha is a asti marma. This is asti marma. Ardhangul pramana. Agni in nature. And I already explained that all Agni marma are Satya Prana, fatal, dangerous. But all dangerous are very good. Radhipati is also dangerous, but it's very good. But dangerous तो है ना, मोदी जी के पास जाओगे तो dangerous तो है, उधर गाड़ी को जरा घुसा के कोई दूसरी गाड़ी देख लो आप, अभी अंदर हो जाएगा. तो but we can't define that everything is dangerous. It is very good. You get immediate effect when you feel bloating, when you feel hyperacidity, when you feel the apana vayus pratiloma gati. अपान प्रतिलोम, अपान वायु प्रतिलोम हो जाती है ना, आपको समय पे खाना ना मिले तो acidity happens and you just press it, release it this point, you find immediate results. So this is the Sankha Marma is directly related with the apana vayu. So you can just do the apana anuloman. Pratilom को क्या करेगा ये? Anuloman, vatanuloman, and definitely it has a good effect on the large intestine, and definitely the movement of the intestine, the apana vayu, samana vayu, definitely, and it is also a very good effect on tactile sensation. यदि नाड़ी परीक्षा भी सीखना है ना आपने, you have to also learn about the pulse examination in coming session. So if you want to your finger sensitivity very good, you have to stimulate your sankha, and it is related with the tactile sensation. Okay. So this is the Sankh Marma. So this is Sadhya Pranahar Marma. Sadhya Pranahar Marma are always dangerous, but you must have to keep in this your life if you properly stimulate this point by keeping your mind that this Marma is Agni in nature. So always implement some oils, massage of some oils like cedar-weed in nature. कोई तेल है, कोई घी है, you can apply over this point. You will get benefits. Definitely. Yeah. But we don't know about this marma. Already we are applying. हम लोग विक्स लगाते हैं, बाम लगाते हैं, अमृत बैंगन लगाते हैं, हमें मालूम नहीं था. आज आपको मालूम चल गया है संख मर्मा है, और अभी आपको सब पता चलेगा. इसके आगे भी. We are 5 to 8 times for a healthy person, 5 to 8 times stimulation, and for a diseased person 15 to 18 times. Okay. So now come to the next point. I have to just time. This is Sadhya Pranahar Marma. So always remember that Brahma Muhurta and Tikasa. But this is not fatal as much as Adhipati. Actually, Adhipati is directly connected with the Sahasrara Chakra. So we can say that हमारे देश में, in our country, the central vista is now going on. You know, the development of the new Sansad Bhavan, where Prime Minister and all the ministers there, they sit and keep discussions about the country's situation. In the same way, this Sankha Marma is also a Sansad Bhavan, in which Adhipati, Simant, Vidur all comes over this point and they discuss about the body issues. So when we give an injury to this point, what happens? Sansad Bhavan में injury दिया था ना? वो किसने दिया था? आपने मालूम होगा? जिसको वहीं पे धराशायी कर दिया था और उसका मास्टर माइंड था, उसको लटका लिया. नाम नहीं होता, वो डिस्प्यूटेड मैटर है. अफजल गुरु. So you know that the same thing is happen here. If you give an injury, it is fatal, and prana resides in this point. But if you stimulate this point, your adhipati stimulus all will get an energy, and definitely it has an effect on whole of the body. But you can stimulate this point in daytime also, but avoid stimulation in midnight time. Okay? So अगर patient आ रहा है OPD में, if the patient is coming in the daytime and is explaining that I'm feeling hyperacidity, headache, or as well as the constipation, you can advise him or her to stimulate this nerve. So clear, this is Sankha Marma. Now come to the next point. It is Apanga. Apanga. You know that Apang Marma. Apang is a sandhi. Apang is a sandhi. The orbital cavity is divided into two ends. One is apang, one is kanina. So apang is a sandhi. End of the eyebrow. Just put your finger at the end of the eyebrow. जरा लगा के देखो. Eyebrow पे रखिए अपना end. देखिए आप. रखिए. You are getting pulsation over that point or not? इधर रखा आपने. eyebrow पे इधर. Yeah. देखिए वो भी मर्म कर रहे हैं. श्रृंगाटक कर रहे हैं. End of the eye. You are getting pulse over this point. मिल रहा है pulse? जी. This is the apang. That point feel pain. It happens. जिंदा है कभी तो दर्द हो रहा है. मरे हुए में थोड़ी आएगा pain. So pain management. So this is the apang. Apang is a sandhi place, but it is shira marma. Put down. It is not a sandhi marma. It is shira marma. Shira marma. And always keep this in your mind that shira and snayu marma should be stimulated carefully. Low pressure. The pressure gradient is that you have to give very low stimulation in shira and snayu marma. You have to give moderate pressure on mansa marma, and you have to give maximum bearable pressure. Always remember in asti and sandhi marma. तोड़ना नहीं है. नहीं डंडा लेके मारना नहीं है. कोई भी मर्मा को अगर हम if we give a maximum injury, then all the मर्मा are fatal. सब मर्मा सत्य प्राण है. Not मर्मा अगर कोई इधर डंडा मार देंगे तो ये भी सत्य प्राण हो जाएगा. But you have to carefully stimulate all the points, giving the regard of the classification that if it is a Agneya Marma, you have to give proper regard. You have to do it in morning and evening. If you know that Sankh Marma is also Agneya, you have to give proper regard. If you know that this is the Saumya Marma, you can stimulate it anytime. If you know that the Apang Marma is also a vehicular and Saumya Marma, so you can stimulate at any time. But Sankh Marma is again Agneya, so you have to keep this in your mind that you have to give a proper means respect to this according to their nature. नहीं कोई गुस्सा वाला आदमी होता है. You know that some प्रकृति किसी का बहुत arrogant nature होता है. कुछ बोल दो तो गुस्सा हो जाएगा भाई साहब. तो क्या करना है? सुबह प्रणाम नमस्कार how are you sir ऐसे ही बोलना पड़ता है. काम निकालना है नहीं. और जो विनम्र है उसको चार गाली देके भी चले जाओ फर्क नहीं पड़ता है. क्यों सर? ऐसा ही होता है ना समाज में. तो मर्मा में भी यही होता है. दिस इज द apang marma. So you just put a pressure over this point, press and release. Just do it, and you find that Sankh and apang marma give you immediate reflex, immediate response. I will explain you how. अभी दिखाएंगे आपको. This is related with the two nadi. One is the pusha nadi, and another one is the gandharvi nadi. The name itself reflects that this marma point is associated with the vision as well as our sensory acuity. Ji sir. This is the apang. So always locate at end of the eye. There is a end of the eye. गलत इधर उधर करेंगे तो फायदा नहीं मिलेगा. कैसे नहीं मिलेगा? अब मेरे को मालूम है ये एसी का स्विच है और मैं पंखा का चला रहा हूँ तो चलेगा एसी? ठंडा होगा कमरा? नहीं होगा. So you have to locate properly. So what I request all of you, yeah, इसका sensory acuity. Sensory acuity means senses, all the senses. So this is the apang. Vision. First is the vision. So reflective errors as well as squint. One patient last year when I came to Trishul, one person came from Hyderabad and her child was suffering from squint. भैंगापन ना इधर देखा होगा आपने squint. So refractive errors and squint is very effective. So it is, but you have to be confident and you have to say your patients to practice this regularly. Yeah, this confidence comes from your side, na? आप खुद ही confident हाँ? Yeah. Yeah, this for student you have to stimulate 6 months, at least 6 months, regularly. Yeah, yeah, morning time. Yeah, yeah, 2 times. Yes, 15 to 18 times. At the end of life, just put your finger at the end of life. No, no, no. And if you go upside, then another marma is there. Remember, अगर आप थोड़ा ऊपर जाएंगे ना तो दूसरा मिल जाएगा आपको. You will get another marma that is known as utapchep. So always take the point very carefully. Okay? So this is the apam. Yeah. It is shome. Shome vehicle leकर. Shome vehicle leकर. Why vehicle leकर? If you give an injury to this point, it leads to the blindness. It is a disability, a type of disability. विकलांगता कर सकता है, अंधा हो जाएगा, मरेगा नहीं, but disabled, blind. अर्धांगुल प्रमाण. Maximum of the marmas are अर्धांगुल प्रमाण. Maximum. अर्धांगुल बोले तो कितना? आधा अंगुल. कितना हो गया? कितना बड़ा एरिया है ना? तो हम लोग क्या करते हैं ना, जब हम पॉइंट्स लेते हैं ना, when we stimulate, we do viddha karma, we do agni karma, we especially in the viddha and agni, not for the marma point stimulation. When we do the viddha and agni karma, the expert is there. We just take the periphery area of that circumference. जैसे ये अर्धांगुल का है ना, अर्धांगुल बोले तो इतना आएगा, तो इधर करेंगे, दूर वाले हिस्से में. ऐसे ही अपने कुछ क्षेत्र पे, दूर वाले. Why in do? What happens that at the center of this point energy resides. What we are doing by doing the viddha karma and agni karma, जैसे किसी को ना, आपको कोई बच्चा है और आपको प्यार से बोलते हो बेटा उठ जा, ऐसे ऐसे करके बोलते हो, अरे उठ जा ऐसे बोलते हो, या फिर क्या करते हो उसका पिंच चुवाते हो, अच्छा लगता है उसको, उठ जाता है वो, क्या हुआ, क्या डंडा नहीं मारते ना उसको आप. तो विद्या कर्मा एंड अग्नि कर्मा हैज अ सिमिलर इफेक्ट. So that's why it is very effective. But we are not doing exactly at the dharma. एकदम center पे नहीं करते उसको. We always do it in the peripheral part. So always keep this in your mind. Expert will also explain you. When we do the Gurfa Marma, Kshipra Marma, Apanga Gata Siravedhan, we always take the points slightly at the peripheral side. So they also keep this in your mind that this is very vital point. But this is very effective. So you ask that. The surgeons explain that these points are very vital. Don't do it. Why you are doing viddha karma, agni karma, you got this point. So the explanation is very simple. Like we are giving us limited threshold of stimulation. Limited threshold of stimulation. You know that in bike spark करते हैं ना, उधर इंजन को स्टार्ट करने के स्पार्क करते हैं, पूरा गाड़ी चलने लगता है. आग भी लगाते हैं इंजन में, आग लगाते हैं. We are not inducing fire, we are just giving a starter fire. So when we are stimulating or when we are doing viddha karma, agni karma, we are just giving a low threshold of energy. So that's why the energy which is just blocking that itself eliminating, and you got the desired results. But I'm saying that you got same result with marma stimulation. So better to do non-invasive things. And it doesn't need anything. देखिए हमने आपको ऐसा होता तो हमारे साथ राजगुरु साहब नहीं आए होते. Giving proper credit to this agni karma, viddha karma, artha moksha. But in Western area or in the region where there are so many medical legal problems, you cannot give any puncture, any heat to the body. The legal aspects are very much. In that country also you can practice karma. Why? Because it is not invasive. You are not giving any medicine, not even giving any trauma, not giving any injury, not giving any invasion. So you can say that it is universally sustainable system. You can practice it anywhere in the world. कहीं भी कर सकते हो आप. From how you will get the results. So this is the apam. Now come to the next point. Sir has already taken a very good tika over the sthapani. This is the sthapani. In some certain siddha, I learned some Burma. They told sthapani as this point. In Malayali, they explain some another thing. I don't know. Anybody who will know the coloring?
Yes.
क्या बोलते हैं इसको?
ललाट। आपने देखा होगा चंदन ऐसे लगाते हैं, थ्री फिंगर, यस यस यस। सो दे त्रिपुंडम, yes त्रिपुंडम. So sometimes I also want to learn that what explanation is that from the that local traditional marma practices. They explain that this is Thapani. तो मेरे दिमाग में है कि they are putting tripundam like this and we are putting the tika like this. So same thing is that nothing is different. You are in Kerala, the marma will be different, and you are practicing in Maharashtra, the marma will be different. Nothing is different. The thing is same. Actually, the ritual practices are different. Where the कुछ लोग त्रिपुंड लगाते हैं, कुछ टीका नीचे से ऊपर लगाते हैं. ये गलत है, ये सही हम नहीं बोलेंगे. But we people just stimulate this by this way. So you have to just put your finger down to up, down to up, down to up, down to up. So that's why जब आप कहीं जाते हैं ना, तो how the Pandit will just put your tika like this. You observe this? So this is Sthapani. Now come to the name of this one point. Sthapani. Sthapit, to establish.
Why the need of establishment in body? Sthapani. This is a ardhangal pramana marma. Sthapani. देखो सबने टीका लगा रखा है.
How much is?
Yeah.
How much is?
Half angle pramana. Maximum of the marmas are half angle pramana. This is one thing is different in this one. This is Vayu Mahabhut Pradhan. So that's why it is known as Vishalyagna. Rajguru Sahab का marma का knowledge बहुत काम करेगा क्योंकि you are doing Agni Karma and Ratna Mokshana. So for all those Karma and Ratna Mokshana, I request all, it is very beneficial for them. This is Sthapani, means to establish. Sometimes you forget something. You cannot recall anything. And what you do? Tak, 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 tak. यार नहीं आ रहा है ऐसे. नहीं करते. Third eye. Yeah, third eye, yes. That is known as the Agya Chakra. Agya Chakra. What is the meaning of the Agya? Control and command. Okay? 5 ministers. The information and broadcasting system. This is the radio. This is the Doordarshan. This is the Sansad Bhavan. So you need one control and command system also. You know that now the government of India has just formed the combined defense system. So same way, body that is known as Sthapani. Sthapani is a Vishalyagna marma and it is a Vayu Mahabhut Pradhan marma. And it is a very, very important that all the 6 nadis, Payaswari, Sankhini, Pusha, Gandhari, Eda, 6 nadis. Payaswari came from the Bihur, right and left, the Apan, right and left, and left side of the Nasika, and Pingla from the right side of the Nasika. So all these 6 nadis come and just they all open in the center Susumna nadi. And it is explained that in Nadi Tantra also, if somebody has the Susumna nadi open, that person will be Trikaladarshi. So I am not a Trikaladarshi person. I am not making you Trikaladarshi. That is known as third eye illumination. So that this is a very important point. So we put आप कुछ भूल जाते हैं ना डॉक्टर साहब तो आपको याद रहेगा और आप डिसाइड नहीं कर पाते कि हमको या कर्मा करना है कि अग्नि कर्मा करना है विद्या कर्मा करना है. Same patient comes and if you have three options, you are little bit confused at what you have to do. Then the Vishalyagna marma, this Sthapani marma, give you confidence that oh आप इसमें marma करो. No, you just do the agni karma. So this makes a decision making capacity of a person very good, as well as the recalling capacity of a person, as well as one thing is holistic that if you are able to open this third eye or the Agnya Chakra, तो क्या हो जाएगा आप खुद ही समझ जाओ. त्रिकालदर्शी हो जाएंगे आप. So this is a स्थापनी वर्मा. Peda Puyaswani, Payaswani. This is Ardhamula Pramana. Ardhamula Pramana. Half of one Pramana. Again I am repeating the Nadi. This is the Payaswani. Right and left. Payaswani is Sankhili. Apang the Pusha and Gandhari. And from the right the Pingala and the left the Eda. Left is the Eda. Left is the Chandra dominant Nadi. Nahi. Eda. Eda means Chandrama. Pingala, Shurya. Right. Always remember this. Okay. So all the 6 nadis meet at the center Sunna nadi and they meet at this point. It's very important. That's why it is known as the Agya Chakra. Third eye. आगे समझ में. And Sthapani. The Agya Chakra, third eye and Sthapani Marma are all located in the same place. This is the Sthapani. एक और तरीका है इसको सिमुलेट करने का. Another method also. Do it by just folding your fingers like this, ऐसा बना लीजिए. और ये ऐसे करके नीचे से ऊपर कर लीजिए. ये इस प्रकार से आप कर सकते हैं. You can just fold it this way and just do it. Yeah. So this. ये देखो इन्होंने स्टॉपिंग बात पर ऐसा लगाया. तो ऐसा भी कर सकते हैं. You will feel a great change on yourself if you do this Marma regularly morning time. This from this. You find a change in your body. You find a change in your body, your attitude, your positiveness. You try today is the session, training session, and you practice this in morning time. इधर ही अपने घर जाके आप करना और सुबह करना. पहले आदिपति, then Siman, then Vidhus, then Sun, then Apam, then Sthapani. Now come to the next point. It is known as Sringataka. 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 Sringataka, do you know Sringataka? Sringataka is a fruit. It is a water chestnut. In the fasting period, we use this fruit. व्रत जो हम लोग करते हैं ना, तो उधर करते हैं. Sringataka अधिपति सत्य प्राण हरमर्मा संख आग्नेय नेचर अग्नि महाभूत प्रधान. Do you know that in Delhi also there is a Delhi is not independent, it is centrally governed, but Delhi has also a minister, chief minister. Delhi में भी chief minister है. So I am explaining that the same way. If you say that the body's capital is Shiv, means हमारा body का दिल्ली है Shiv. दिल्ली में बैठा है मोदी, तो दिल्ली में ही बैठा है इधर Sringataka. That is Kejriwal. You can explain the same chief minister. And he has also power. Power तो है ना उसके पास. दिल्ली का हुक्का पानी सब उसी के पास है. पानी बिजली खाली उसके पास वो नहीं है. पुलिस नहीं है. दिल्ली पुलिस नहीं है. मांग कर रहा है पुलिस भी दे दो हमको. बाकी सब है. पानी चाहे कभी किसी का नल बंद कर देगा. हॉस्पिटल भी उसी के पास है. Same way this is Sringataka. बॉडी का देखो ना आप कैसा व्यवस्था किया है भगवान ने, गॉड ने. जैसा बाहर बनाया वैसा ही शरीर के अंदर बनाया है. नहीं बनाया है. The same way what is you are looking outside, यह तो पिंड का तो ब्रह्मांड है. What is going outside that is inside our body. I am just explaining it. I am just giving an example to just giving my lecture very smooth. आपको समझाने में आसानी हो इसलिए I am giving certain examples. Sringataka. Sringataka is a fruit that is known as water chestnut. And if you look this fruit, it is having a 4 corners. याद कीजिए तो आप Google सर्च करिए अभी नेट पे water chestnut. You find that there is a 4 corners. 4 corners. So when you cut, slightly dissect this part, you find same bone like Sringataka. And 4 corners. I
just before this point, I just immediately explained 4 nadis: Payaswini, Sankhini, Pusha, and Gandhari. These all the 4 corners represent the connection of the 4 points. ऐसे लगता है ना जैसे 4 चीजों को जोड़ दिया तार को, ऐसे ऐसे ऐसे, इधर से 2 तार जोड़ा, इधर से 2 तार जोड़ा, इधर फंसा है, जंक्शन है. This is the junctional point, and the main wire of the Sushumna nadi comes at the center. This is Sringati. Now, Sringati. Now I will explain. Just I am coming to the location also. First of all, what is my style of teaching or training? First, I am just giving biodata, that where it is located, how it behaves. Then I will come to where it is present in the body. So, I will bacha hua hai. 4 in number. 4 in number and powerful. Powerful means which Mahabhuti is predominant? Agni. So, what type of marma it is? And 4 connections: Pusha, Gandhari, Payaswini, Sankhini, and Sushumna. Definitely, during the COVID period, you observed that certain person had got infection, but they don't get any symptoms of the chest region. उनको कोई सांस में तकलीफ नहीं, no breathlessness, no any active symptoms, but they all are positive, COVID positive. But one thing you observe that they got certain preliminary symptoms like smell gone, taste gone, problem in auditory sensation, and problem with vision. Do you observe this thing during COVID? ऐसा हुआ था ना? कोई सांस कुछ नहीं फूला, ऑक्सीजन वगैरह, everything is okay, oxygen saturation is very good, everything is very fine, but you find that this sensory problems like taste is not proper, smell is not proper, like there is some difficulty here. You observe that this is actually Sringataka Burma's affection. Actually the Sringataka Burma got affected. The COVID just goes and stuck over there. It doesn't, the Sringataka Burma is very active. It doesn't allow to move the infection further at the respiratory tract region. That's why the other symptoms start. And you observe that got the active COVID symptoms, they don't get such symptoms. Means Sringataka Burma is not capable to stop that infection. That infection overpowered the Sringataka Burma and it just stopped the respiratory area. So we can see that the Chief Minister or the NASA he Siraso Dwara, if you want to go to meet with Adipati, you have to first meet with the Kejriwal. That is the Sringataka, 4 Burma. So you know that the Panchakarma practice, we all practice the Nasya Karma. You know, everybody knows. So Nasya Karma is also effective due to the Sringataka Karma. So when we put oil or we just put any powder or we are giving the Prati Nasya or Nasya, whatever result we are getting, that result we are observing through the Sringataka Karma. You know all these things. So later on, the Ministry of Ayush also accepted this, and in our protocol, Ayush protocol, the Pratima Sanasya is introduced. You know, just put some oil over this point. Nothing. If oil is not there, you can put your drita over there. This stimulates and lubricates the Sringataka and Phana. Phana will come back. Yeah, Neti. You are doing the Neti Karma, Jala Neti, Sutra Neti, everything that is effective to the Sringataka Karma. So you can see that the Sringataka Burma has a positive effect. What? In the hearing, taste, smell, and as well as the vision. For 4 senses. So this is the Sringataka. Now the sir had asked, where is the location and how to stimulate this Burma? This Burma is 4 Angula Pramana. 4 Angula Pramana. 4 Angula. So how you can observe 4 Angula Pramana with all of the nose? No. It is 3-dimensional. Means this Burma is 3-dimensional. If you cut sagittal section of your head, you find that it's internally associated with the soft palate, and externally it is associated with 1/3 part of your nose. 1/3 part of your nose. Then how we can stimulate? Actually, the way of stimulation, whatever we are taking, जो भी हम कुछ प्रेरण करने का तरीका ढूंढा है ना हमने, ऐसा करना है, इधर करना है, आप पूछेंगे सर
in which book this reference you got, you find. This is also a question. Can ask simple question. And how you are telling that no, I will not do. I will do this way. Adhipati is saying, no, I will do this way. The question simply arises that where this reference you find. So this is a very common question. So I am giving you explanation that this is a properly protocol is developed and designed by observing the simple human behavior. When you got any stress, you just put your head over this point. So there is a position of closed lotus position. You know that it's in Brahmins and other rituals, the Jana will be just clear at the Vidur Marma point. You know the Karna Vedan Sanskar, the Bali. Yes, you know the Sthapani point. So these things observed and taken from these points. So that's why, and according to the comfortable of the person, the fingers use. Why? We can no, I will use index finger for Vidur. You just find when you thumb it, you will get more comfortable. You are comfortable. So why the thumb is used? Sometimes I am just explaining that you have to just press to the index finger. Most of the point we are simulating to the index finger, but in Adhipati I already explained that you have to put your all the 5 fingers. So these are the protocols developed according to the comfortable and the desired results and the stimulation. So always keep this in your mind. There is no such references in any ancient text. As you all know that where our ancient text, so many texts are not available. बहुत सारे जो विद्यार्थी पूरी डेवलप की. So now how you stimulate? Regarding Burma is stimulated like this. You have to put your thumb and index finger in this way. Just put this way at the inner canvas of eye, and just put a massage, gentle massage. Press it inside. Press it inside. Just give pressure. Release. Press. Release. Press. Release. Gently press. Yeah. Just press it and release. You find that in certain child also there is dry eye cases. You find that in dry eye cases, the obstruction of the lacrimal, yeah, you have to press it, release, yeah. This press, release, press, release, press, release, press, release. Press, release, press, release. In the inner canthus, जहाँ पे चश्मे का हुआ था ना, this is the inner canthus. You have to press it, release. Press. Gently press, release, inner canthus. What effect you find when you stimulate this Burma? Your vision, your auditory, your taste, and your smell, 4 senses will be dropped off. And another thing is that your immunity, ultimately your immunity, because you know that NASA heat seals so dwara. The ENT infections which is coming from the nasal region, the Sringata Burma protects it. Defense है ना, केजरीवाल बैठा है ना, so definitely it will. So that's why our Nashya Karma is very effective. And during the Nashya Karma, this is not only effective for this region, Uttamam. The effect you find in the lower part of the body also, because the nadis are associated, and all the nadis having connections with the body, and it has lots of direct or indirect effect on Adhipati Burma also. So by putting any oil or giving any Nashya Karma, actually we are just nourishing and nurturing the Sringata Karma, and actually we are putting medicines to this nadi, which is just going to the head region, and that is the central nervous system, which is a connection over whole of the body. So Sringata Karma as well as Nashya Karma has an effect throughout the body. Even sometimes in infertility cases also, the Nashya Karma is very effective. So this is the reason. And now the final Marma of the head region. I will complete this head region Marma in this session, and then I will give you a break. I think how much time हो गया? 10 minutes. So I will just 10 minutes में छोड़ दूँगा. बोर तो नहीं हो रहे हैं? बोर नहीं होना चाहिए. This is 4 angle Pramana. Yeah. 2 angle Pramana, but internally it is 3 dimensional. Soft palate, up to soft palate. जो मर्मा है ना, ये बाहर से आपको दिख रहा है ऐसा. You are finding this, but it is actually 3 dimensional. मैं खड़ा हूं ना यहाँ, तो मैं सामने से तो आपको ऐसा दिख रहा है, मेरा चित्र बनाओगे आप तो कैसा दिखेगा, एक ही तरफ का दिखेगा ना। तो मेरी लंबाई है, आई एम इन लेंथ, आई एम इन ब्रेड्थ, और हमारी गहराई भी है। यू कांट फाइंड द girth or deftness in any photograph. So this you can imagine that all the Marma points are three dimensional. So the length, breadth, and depth. Understand? नहीं समझ में आया? नहीं आया? So soft palate, up to soft palate. You observe that when you vomitus, when you got a nasal infection or viral infection, you find that there is a itching in your soft palate also. Sometimes there is a itching in soft palate also due to the stigmata. So yeah, I will explain how you can simplify. I will explain it. Last I will explain. The last head Marma is I just skipped two Marma. I'm just clearly explaining that it is not possible that I will explain all the Marmas in only 2 days sessions. Actually, but the Karma session is also pending. Last I have skipped Uttakshep Marma and Avartma. दो मर्मा छोड़ दिया मैंने, ठीक है, लिख लो आप, बता देता हूं कहां पे। Just above the Sankh Marma, 2 finger above the Sankh Marma, there is another Marma which is known as Uttakshep. So if you mislocate the Sankh Marma, you will approach to the Uttakshep. So always keep this in your mind. Uttakshep ऊपर क्षेप कर रहा है, superimposing. So above Sankh Marma, yeah, 2 अंगुल प्रमाण above, yes, उस पर से हाँ, 2 finger this is above the Sankh, this. So इसको हमने गोल कर दिया है अभी, इतना बताएंगे तो ज्यादा हो जाएगा. Just locate. It is a very good Marma for trigeminal neuralgia. Note down Unmad and Apasmad. This is पोजीशन आ रहा होगा, थोड़ा थोड़ा इधर उधर करके. Uttakshep is also Vishailek Marma. Always remember 3 Marmas are Vishailek. 1 is Sabri and 2 is Uttakshep. Uttakshep is very effective for बहुत ऊपर चले गए आप, थोड़ा सा ऊपर, बस 2 अंगुल ऊपर जाना है. 2 finger above the Sankh Marma. Yes. हाँ, थोड़ा सा, 2 अंगुल, बहुत ऊपर चलेगा, थोड़ा नीचे. You find the pulsation over that point. Yeah, joint is also there, and you find a fit also, not to one leg. Okay, you try that. Go the pulsation. You find a pulsation over that point. You find a pulsation over that. You find a pulsation. Uttakshep and Sthapani are Vishailek Marma. So I am not going into detail. And now the 2 Marmas are also present in between the eyebrow. Just put your fingers in between the eyebrow. No, between the eyebrow. बीच में, eyebrow के बीच में. ये eyebrow के बीच में लगा लो डॉक्टर साहब. Just put your fingers. आपको दर्द होगा, थोड़ी देर आप रखोगे ना, दर्द होगा वहाँ पे, थोड़ी देर से रखेंगे, थोड़ा नीचे eyebrow के बीच में. देखो थोड़ी देर रखोगे तो आपको between the eyebrow. Calamity. Yes. Pain. Pain. You are feeling pain. Yes. Why? This is Avarta. Yeah. Avarta Marma. Calamity. Avarta. I am not going into the detail. Actually, this Marma is very effective for the vision. So vision, we are doing the Panchakarma procedure like Ashruta, like Netra Darpan, as well as the Shirodhara. Shirodhara, when we put Dhara, so Sthapani to the Apam, to the Sankh, to the Seema Uttar Pradesh,
all the marmas, Shirodhara is also a part of Kaya Sake, you know. So Sira Sake. So actually we are nurturing and nourishing these marma through the Shirodhara, through the Shiro, through the Shirovasti. So this is very important point. This is important point for the Manasik Vyadhi. This hour. Unmad, Manobata, Manovaha Sotasa. This is effective in Manovaha Sotasa. Unmad, Apasmar, and other psychological problems at the center of the eyebrow. Center of the eyebrow. Put your finger at the center of the eyebrow. You find a notch and there is a pain. So it is easily find. You can easily find this point. So now I'm not getting detail about these points. So this is the avarta. Avarta. ठीक है sir? Clear?
It's called Purva.
Yeah. Purva Dhadu Marma. What he is explaining that this Marma is in Siddha Purva Dhadu Marma. Same point explaining the language is different. The point is same. Point is not different. So Marma is always same. Either it is practiced in Siddha, either it is practiced in UP, Bihar, Uttarakhand, Maharashtra. Everything is same. The knowledge is same. So now the last Marma of the head region, that is the Fana. 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 So after Fana, I will complete this session. Fana. Uttakshet Marma is similar to the Sankh Marma, but it is a specific benefit. कहते हैं ना साधु के पास रहोगे तो साधु बनोगे. तो संख वर्मा के पास है उतक्षेप. उतक्षेप is nearby to the संख वर्मा, so it has a similar effect as of the संख वर्मा. But what different is it controls and it gives good smell sensation. Just write down here. संख वर्मा is good for no. Remember tactile sensation, touch, and this is for smell. Smell, touch, vision. Everything comes on these three marmas. Triangle of marma. This is a palm, this is sun, and this is uttrakshep. So there is a triangle. आप triangle बनता है देखो इधर. पेंस पे डिजाइन बनाते हैं इधर आओ. ये देखो आप इधर आगे आगे. मैं डिजाइन नहीं बनाऊंगा आपका फिर आप नाराज हो जाओगे. मैं इधर दिखा रहा हूँ. This is the apam. Okay. This is the apam. This is the sun, and this is the hour. There is a triangle. Triangle? है कि नहीं? Triangle बन रहा है कि नहीं बन रहा है? There is a triangle. Triangle of three marma. This is the apam. This is the sankha, and this is the uttrakshep. So we need to draw a line and just connect it. There is a triangle. Yeah. This is the triangle. So there is a triangle. Three marmas. So all the three marmas have similar effect. Apam Varma has an effect on vision. Sankh Varma has an effect on touch, and our Uttrakshep Varma has an effect on smell. Triangle of Varma. So whenever you give an injury to this point, definitely all three marmas are fatal. Yes, we know that Sankha is fatal, but we nearby our Uttrakshep, all the marmas are fatal. But Uttrakshep is visual level. Sapni and Uttrakshep are visual level. And apam is already I explained vehicle level. So okay, now clear? Yeah. In regular practice, we can't do the avarta marma and uttrakshep marma. Regular stimulation we don't advise. But particular patient is coming for treating like nimada, apasmara, or other conditions, we stimulate specific marma. So I excluded this marma, but I'm taking that you all are taking interest. That's why I explained this.
Last.
Yeah.
Last two marma.
Fana. Yeah. Is a question? For any patient who is coming like Bala Apasmara, you have to stimulate two times. Yeah. Only two times. And how many times it depends on the condition. But you always remember that you have to give medicine also. By only giving marma, you can summon chikitsa has an also important role. But the marma will facilitate the effect, desired effect. I am just explaining that one female is giving infertility management from very long term to a patient, and when I trained her to stimulation of the gulfa and Kshipra marma, Pada Kshipra marma,
She accidentally advised her patient, along with your medicine, you just stimulate this one. She don't take it seriously, but her patient take it very seriously, and he just started the stimulation of the Burma. After 7 or 10 days, he came back to the doctor, and she's telling that I conceived, and so she told me, sir, मैं बहुत दिन से दवाई दे रही थी, पर मैंने कहा तुम्हारा दवाई तो 6 महीने चल रहा था. You are giving medicine from last 6 months. You don't get any results. But when you explain the Shukra and Gulkumarma stimulation, everything is okay. So you can just use the Burma Chikitsa as supportive measures. Whatever you are giving homeopathy, you can do it. But you also practice this value-added treatment. I am just explaining that it is a value-added treatment. So now ask Burma, Burma. So every Burma point is clear now. 1 बज गया है. 1 o'clock. Fana is last. Yes. Fana. So Fana means the serpent hood. सांप का फन. सांप का फन होता है ना. सांप का फन किधर होता है? Where there is treasure. सांप जहाँ सोना होता है, खजाना होता है, वो सांप ऐसे नाग नागिन फिल्मों में देखा होगा आपने. सुरक्षा करते हैं. They are guarding. When you look the names of the Burma, you think that this name, who has given this name? किसने दिया ये नाम? आवर्त, सीमंत, अधिपत, किसने दिया होगा आप बताओ? Just you think about your brain. Who has given these names? Shushuta?
Lord Shiva.
Lord Shiva. Very nice. So every name has certain meaning. मेरा नाम नवीन है तो there is a meaning. आपका नाम मेघना है तो meaning. सर का नाम विजय है, का नाम विजय तो meaning. वो राजगुरु सागर तो गुरु हैं वो. राजगुरु हैं वो. गुरुओं के राजा हैं. Every name has certain meanings, sir. So these names is given by Lord Shiva. So we cannot take it lightly. हल्के में नहीं लेने का. तो फड़ा means serpent hood. अच्छा आपने देखा होगा सांप जो होता है, snake. When some foreign object or snake का हाथ खींचता है, देखा आपने? गुस्सा में होता है. When he सांप वैसे फन नहीं लेता है, नाग, कोबरा, simply like this. But when some enemy is there, just threatening for threatening, तो खाता है ना वो. Same name is word, same word is used for here. अच्छा आपने केरला में है, आपने आंध्रा, ऐसा बर्मा सीखा आपने कभी? ऐसा कोई एक्सप्लेन किया आपको कि फड़ा है तो ऐसे सांप खींच के बैठा होगा? Nobody can explain. The name itself explain you that this is a guard. So if you look at NASA, he is Sudhara. Sir is your Uttamam. The Prime Minister is sitting here. Kejriwal is sitting here. Your Sansad Bhavan is here. Doordarshan is here. Akashvani is here. Central Defense Controlling System is here. नहीं? केजरीवाल is also here. इतना सब कुछ है. तो ऐसे ही पहुंच जाएंगे आप वहाँ इन सबके पास. There is a barrier. आप दिल्ली में, if you go to the Prime Minister office, there is a barrier. You have to give your Aadhaar card. Purpose of visit, you have to first take the appointment. In Delhi also, if you go from any border, there will be check post. So same way, as you know that this is a very vulnerable area, and we are taking inspiration and expiration continuously. So thousands of millions of infections are there. Do you know? COVID is still present, and long term back it is also present. COVID is not a new infection. Yes, COVID-19 is a new. Corona तो बहुत पहले से था. Corona is a very old name. Okay? So, but every infection is not entering our body. Why? There is a protection. There is a nasal protection, nasal papilla, nasal hair. But one thing we forget, there is a Padamarma. Padamarma is a serpent hood that is protecting the negative things. Don't allow. Positive things go. Don't allow and go. So we breathe oxygen and pranavayu comes inside, and the negative things like infections, bacteria, if the guard is active, if the guard is sleeping, what happens? Everything will go. आपने चौकीदार रख लिया पैसे देके, नीचे गार्ड, और वो सो रहा है, क्यों सर? तो कोई भी जाएगा, चोर जाएगा, डाकू भी जाएगा, पॉकेट मार भी जाएगा.
But if you give a proper activeness, if you are checking the proper activeness of this point, definitely that will take his duty properly and keep barrier to these negative things, means the infective agents. So this is the pharma. So that's why the pratimars nasya we just apply over this point. You observe that हमने बोला खाली नाक में लगा लो ऐसा तेल, ऐसा घी लगा लो, that will create a lubricative atmosphere and the infection got there stuck over there and they will not get. ऐसा होगा क्या? ये बताया ना Ministry of Ayush ने. But क्या it is scientifically possible? Yes, possible due to this marma. Actually, this is the prana area. This is the marma area. So it is a Saumya marma. It is Vaikalika marma. Its name is guard. Name is given. Prana means guard, means serpenthood, and it is Vaikalika. It is directly related with the smell function, smell sensation, and one thing who is suffering from snoring problem, kharata. Kharata, do you know? So many people will, when we sleep in nearby to you, you can't sleep. गाड़ी चल रहा है, ट्रेन चल रहा है, जनरेटर चल रहा है साहब। वो टाइम हम एक बार ट्रेन में जा रहे थे, मैंने सर बगल वाली गाड़ी बगल वाला बर्थ पे सो गया है, इतनी तेज समटाइम्स तो सांस रुक जाता है उधर एकदम। In that condition, this marma is very effective. How you have to stimulate? You have to put your small finger. Just put your small finger and just lift it outside. Yeah. You have to press it and release. Press it for 5 to 8 times for healthy person. With small finger. Why the small finger? And you know that the small finger is the Jalamahavu. So we can stimulate with the index finger, but preferably the small finger, if you stimulate, you will get more desired. So you check anybody in your family member who is suffering from snoring problem. You find that this is very effective in nasal obstruction, in nasal blockage, in sinus problems, in sinusitis, in allergy, in different conditions. You find this marma very effective. So I completed the head reason marma. Adipati 1 marma, Simant 5 marma, Vidhur 2 marma, Sank 2 marma, Utakshit 2 marma, Apam 2 marma, Avat 2 marma. Another Snapni, Sringata, 4 marma, and finally Fana. So all the marma points of the head region is now completed. So you just yes, अपना आँख बंद कर लो. Keep your mind, keep your eye closed, and just find all the marma. If you find it in your head, then you say, okay, I just got all the locations. देख के बताओ सब marma. Adipati, you are getting? Yes, tell yes. Simant, Vidhur, Sank, Utakshep, Apam, Avat, center of the eyebrow, Sthapni, Sringata, Fana. तो हो गया ना मर्मा, कोई मर नहीं है इसके अलावा. No other marma is present in head region. So all the marma of head region is completed. So I hope that now you are an expert in head region. So any question you can ask. Now this lecture is finished. Yeah. Take your mic. You are independent to ask any question. This is a workshop. This is not class. So always remember, you have to give.
Beside me is Dr. Satish. Beside me is Dr. Satish, who is suffering from tinnitus and hearing loss since 4 years.
Yeah.
So can we apply the Vidhur? How many times? So once we get them on.
This is a patient.
Kalyani ji. Okay, she came from Karnataka. You just see, you have problem associated with what is the
1090 last of hearing since 2019 like 22.
So you are a doctor. Both are doctors, and I hope that definitely you follow what I just read you. You have to stimulate continuously the Vidhul Marma, Sankh Marma, Apang Marma, Utachek Marma, Avark Marma, Sringatak and Front. Always remember. Again, I am repeating Vidhul. Can I put a mark over this point? So always one thing you always as a trainer you have to take a marker. ये ऐसे नहीं बताने का पेशेंट को मार्क लगाने का क्योंकि भूल जाएगा ना वो चाहे डॉक्टर ही है इज अ डॉक्टर एंड both are doctors but you have to put a mark लगाने this is the point this is the vidhul this is the sankha this is the apanga this is the apanga and same the avarta. So this is a triangle. You observe the triangle. This is the avarta, apang, avarta. This is the this is the utachek. This is the avarta. So and sringatak and prana. You can estimate sthapani as well. So all the except the adipati and siman, you can estimate all the marmas regularly 3 times. And in morning and trikal sandhya time, you add adipati and siman. So this will definitely give you benefits in hearing. As well as another problem is tinnitus. Definitely it will work. So इनसे मिल लीजिएगा इनका नाम नंबर नोट कर लीजिए और 6 महीने after 6 months what result you get group में डालिएगा आप you are in group WhatsApp group yeah so you put your results on definitely ये इनको एकदम फायदा होगा you will get definitely good results. What I told him first stimulate the Vidhul, Sankh, Kshe, Apam, Avar, Sthapni, Sringatak, Prana. And at morning time, you have to add Adipati and Siman. Other months, he can stimulate 3 times, which daytime also, but Adipati and Siman, he excluded in daytime. That's right. And after 2 or 3 months, you take a feedback from him. He will explain to you what result he got.
So three doctors went through all the treatment methods.
Yeah, you now at last I am just giving you a demonstration how you have to stimulate all the marma in single time. तो बैठ के आप देखिए लास्ट में खत्म करेंगे बैठ जाइए आप सब आप भी बैठे आप भी बैठे वहीं स्ट्रिक्ट मैं करके दिखाता हूँ अब क्या करना है आपने this is known as the Brahmari pranayama इसका ये आ रहा है ना रिकॉर्डिंग डाल देंगे ये फेसबुक पे लाइव जा रहा है नहीं दिख रहा है थोड़ा नीचे कर दीजिए अभी दिख रहा है अभी भी नहीं दिख रहा है कोई बात नहीं इसका प्रॉब्लम है कोई बात नहीं हमारा प्रॉब्लम नहीं है ये हम प्रॉब्लम में इधर बैठे ना यहाँ बैठ जाते अब दिखेगा इधर इधर बैठ चलो यहाँ से दिखाते हैं एनीवे वो डॉक्टर साहब आप आ जाओ इधर कहाँ गए आप लंबे हो हाँ वीडियो रिकॉर्ड कर सकते हैं हाँ क्यों नहीं कर सकते आप सब कर सकते हैं आप के लिए तो है किसने बोला नहीं कर सकते अब आप चले जाओ मैं बैठ अब ठीक है अब आगे अभी दिख रहा है अभी दिख रहा है ना अभी सेटिंग सही हो गया अब आपने क्या करना है देखो अपना शंख पे उंगली रखो विदुर पे रखो ऐसा अंगूठा रखो विदुर पे वीडियो मत बनाओ नहीं तो फिर आप तक कैसे करोगे फिर एक हाथ से वीडियो बनाओगे मजा नहीं आएगा फिर बता देंगे आपको शंख पे रखा तर्जनी इंडेक्स शुड बी एट अपांग पे रखा विदुर शंख पे रखो तर्जनी इंडेक्स शंख और ये मिडिल अपांग देखा आपने
and the ring finger at the Sringatak and a small finger at the Phana. देखो, देख रहे हैं आप? Just look again. I am repeating. Thumb at the Vidur, index at the Sank, middle at the Apam, ring at the Sringatak, and small at the Phana. What is now? It is Shanamukhi Mudra. It is known as. अब जीभ को ना ऊपर कर्ल करके सॉफ्ट पैलेट पे लगाओ. Tongue, curl your tongue, and deep inhalation, and just when you exhale, you just do the Brahmara sound. Again, repeat it. Deep inhalation. And third time. Just relax your, just putting your hypothenar eminence over the netra, avarta, and just feel the relaxation. कैसा लगा? बढ़िया लगा? This is the way of doing internally the Sringatak Dharma. By putting your tongue above the soft palate, what you have done, you have just gently stimulating the inside Sringatak Dharma. So somebody asked that अंदर से कैसे करेंगे? तो छोटा किसी ने पूछा था. This is the way of the Bhramari Pranayama. So by doing Bhramari Pranayama and by doing this Saranamukhi Mudra, you are just pressing your Vidhur, your Sankha, your Apanga, your Sringatak, and your Phanama. So this is a very good practice. So you can practice this in a morning time. By simple these methods, you can stimulate and recharge your body. So thank you. Any question? If you have, you can ask.
Sir, can you withdraw this?
Yeah.
Okay, one second.
Only.
1 second there.
We have put it our thumb at the Vidhur Marma, index finger at the Sank Marma, middle finger at the Apang Marma, the ring finger at the Sringatak, and small finger at the Phana Marma. Curl our tongue and just curl it at the soft palate. Gently inhale, and by exhaling, we are just making Gunjan of Bhramar. This is the stimulation of Vidhur, Sank, Apang, Sringatak, and Phana at a time. So this is a good practice of the Bhramari Pranayama. आ गया समझ में? Everything is clear now. So if you have any questions related with the head marma, you can ask. I have communicated all the marma points of the head. Next session, I will explain you the upper extremity marma points. So now I think that 1 बज गया है. Now what is the our session? इसके बाद क्या है? Doctor Saab, what is the Rakta Mokshana? So I think that according to the schedule, 2 p.m. is the lunch time. So before lunch time, अभी बोर तो नहीं हुए ना? हाँ, इधर छोड़ेंगे नहीं आपको. इधर आपको इतना नॉलेज देंगे कि आप याद करोगे कि कोई आया था. तो हमारा प्रोग्राम बोलता है, according to our program, the keynote speech by विजय यादव, तो वो हो गया हमका. अब जो है इसके बाद होना है, इससे पहले हम रक्त मोक्षण एंड अग्नि कर्म. तो अब मर्मा सीख लिया आपने. अच्छा, कोई डाउट तो नहीं है आपको सिर का मर्मा में? एनी डाउट? कोई शंका लेके मत जाना, कोई शंका लेके मत जाना. जितना सीखो, थोड़ा सीखो, अच्छे से सीखो. एनी डाउट? एवरीथिंग
and 6 a.m. morning. Empty stomach with loose clothes. Yeah.
Yeah, you can do Adhipati Sthapani. Sthapani is more beneficial. So now the next session is of Ramesh Rajguruji. So I'm just hand overing the mic to him, and I think that this session will also more practical. So Ramesh Rajguruji, welcome.
Yeah. After this beautiful session, actually, what I am going to talk is on Rakta Moksha. It is a technically surgical procedure. It is a surgical procedure.
You can take this.
It is a surgical procedure. Actually, what sir had given his demo on Marma was non-surgical technique. It is a non-surgical technique, but my technique is totally different from Marma Chikitsa, but it is definitely helpful for us to have a knowledge of adequate knowledge of Marma in our Rakta Moksha practice, because Rakta Moksha is described by Susruta as a half of the treatment of surgery. जैसे कि बस्ती चिकित्सा is half of the treatment of surgery. One is Vaman, second Virechana, third is Vasti, number 4 is Nasya, and number 5 is Rakta Moksha. Rakta Moksha is described at the top, that is crown of the treatment. That is the crown of the treatment. How many of you are Ayurveda graduates? Please. Please. Thank you. So how many times you have applied Rakta Moksha on patients? Is it clear? What is the philosophy of Rakta Moksha? Do you know? What is the philosophy? That is the effect of Rakta Moksha. Is it? What is Idam Agam Siddhatva प्रत्यक्ष फलदर्शनात् मंत्रवत् सप्रयोक्तव्यम न मीमांसम कथंचनः। ये जो उन्होंने जो बताया है वागड उत्तर स्थान 40 और श्लोक नंबर 81, उन्होंने बताया है हमें कि ये जो मैं बता रहा हूं ये सिद्ध हुआ शास्त्र है, सिद्ध किया हुआ शास्त्र है, उसका प्रत्यक्ष फल मैंने देखा है, उसका प्रत्यक्ष फल मैंने देखा है। ये मंत्रवत आप प्रयोग करते रहिए, जैसे कि आप सबसे सुने मर्म चिकित्सा का ये मंत्र आपको दिया है, ये बीज मंत्र उन्होंने दिया है, और ये बीज मंत्र आप हमेशा अगर इस्तेमाल करते रहोगे, that you practice daily in your day-to-day life, in your practice or in your clinical practice, that will definitely give you fantastic results to your patients, and definitely you will be one time you will be here in my place. I will definitely claim this. So मंत्रवत् प्रयोक्तव्यम न मीमांसम कथंचन, उसके लिए मीमांसा मत करो, यानी कि उसके ऊपर don't ask for explanation, because it is already proved, and you have to prove it by using it in your daily routine practice. सबको पता है all are Ayurvedic doctors, तो वायु का स्थान शक्ति स्थानं वातस्य तत्रापि पक्वादानां विशेषतः। तो अगर वायु का स्थान पक्वाशय बताया गया है तो पहले पक्वाशय तो ठीक होना जरूरी है, लेकिन हमारा पाचन होना बहुत जरूरी है। अगर हमारा पाचन अच्छा नहीं है तो हम लोग बीमारी पड़ेंगे, क्योंकि रोगा सर्वे जानते मंदे अग्नौ, इसीलिए हम लोगों को हमारा पक्वाशय हमेशा ठीक है, घटकर है। प्रमोशन के यहाँ मैं आता हूँ, प्रमोशन जो है 2 पार्ट्स में होता है। एक तो शस्त्र के द्वारा किया जा रहा है, लोग जो प्रमोशन करते हैं उसमें हम इस्तेमाल करते हैं खाली जगहों का लीच, आपको मालूम है ना जी। और शस्त्र के द्वारा जो होता है उसमें हम इस्तेमाल करते हैं एक तो सीज यानी कि नीडल्स, फिर उसके बाद में हम लोग इस्तेमाल करते हैं ब्लेड्स, शस्त्र एज अ शस्त्र, ठीक है। फिर उसके बाद हम लोग इस्तेमाल करते हैं घटी यंत्र, फिर उसके बाद होता है अलाव। ये सब में हमको पहले शस्त्र से प्रच्छान यानी चीरा लगवाना जरूरी होता है, चीरा लगवाना बहुत जरूरी होता है। उसका मात्रा भी दिया है अर्धा यव मात्रा। आपको मैं सब कुछ अभी डिटेल, खाली आपको ये इंट्रोडक्टरी में बोल रहा हूँ, प्रैक्टिकल सेशन तो कर आपको दिखाऊंगा, मेरे पास वीडियो बहुत है, लेकिन थोड़ा सा समझा लो, समझ लो। अर्धा एवं मात्रा में त्वचा के ऊपर आपको छेद करना है और वहां से आपको प्रचार करके खून निकालना है। फिर उसके बाद में कुछ स्पेसिफिक पॉइंट बताया गया है। तो आप लोगों ने सब लोगों के पास पेशेंट तो बहुत सारे आते हैं, हमारे पास भी बहुत सारे पेशेंट आते हैं। हम लोग कितने मिनट में पेशेंट को रिलीफ देना चाहिए ये हमारे हाथ में रहता है। That is our hand. So before that, just I have told you in my introductory speech that I was using allopathy, but when I saw that Ayurveda is also very effective, nowadays I am asking history, पहले मैं सुन लेता हूँ पहले मैं अच्छा सुनता हूं, फिर बाद में लोगों को मैं बोलता हूं भैया you are complaining this thing, now what do you want from me, what is your आपकी डिजायर क्या है, कितने मिनट में आपको ठीक होना है, कितने मिनट में आपको ठीक होना है। पेशेंट की इच्छा रहती है कि हमें अच्छा होना, अभी अभी अच्छा होना है, अभी अच्छा होना है, सही बात है। You can accept that challenge and you can give the result immediately. I have one patient, he came from very long place, just 80 to 90 kilometers away from my native place. He was having headache from last 5 years. सर ने अभी आपको बहुत सारे बताए हैं, स्तपनी मर्म, उत्सेप मर्म, आवर्त मर्म, हर एक का महत्व है। उसका मैं थोड़ा सा भी एग्जांपल देता हूँ, उसका वीडियो में बताता हूँ। He was complaining headache and he had lot of treatments he has taken, but he don't have result. कोई रिश्तेदार ने उसे बताया ये बंदा काम करता है, आप जाके देखो। पहली बार आ गए तो हमने उसको पाचन चिकित्सा दे दी और सर्वाधिक रक्त मोक्षण किया। फिर आफ्टर 10 days इंटरवल मैंने उसको वापस बुलाया, 10 days इंटरवल के बाद वापस बुलाया और उसके शंख मरण पे थोड़ा सा मर्मस्थान को छोड़कर उसको चीरा लगा के उसका रक्त मोक्षण किया। इसको आपको मालूम होगा वो क्या चीज है। यूनानी में क्या बोलते हैं, निजामा बोलते हैं ना। उसको अच्छे से नींद आ गया, दोनों साइड में रक्त मोक्षण करने के फिर उसको स्तपनी मर्म के साइड, उत्तर की साइड में रक्त मोक्षण कर दिया। It was my last session. Actually 3 sessions में कंप्लीट करता हूँ मैं, तो 3rd सेशन में उसको बोल दिया कि इसके बाद में मुझे 1 महीने बाद मुझे वापस दिखाना है। ठीक है, I did रक्त मोक्षण from स्तपनी मर्म, स्तपनी मर्म। He got 100% result, 100% result. उसका हेडेक पूरा चला है। He was very happy. So you can perform and it gives a perfect result. अगली सेम अगली कर्म कैसे करना है, क्यों करना है? Where there is a शिरा संकोच, सर ने बताया है, शिरा स्नायु संधि अस्थि, अगर इनमें पेन है यानी कि ज्यादा से ज्यादा दर्द होता हो तो वहां हमने अग्निकर्म ही करना है। अग्निकर्म करने की प्रस्तुति है कि वो तुरंत बीमारी को दूर कर देता है, तुरंत बीमारी को दूर कर देता है और अपुनर्भव यानी कि रिपीट नहीं होता, रिपीट नहीं होता है। अग्निकर्म करने के बाद हमें जो भी अपने को अग्निकर्म करना है उसके बाद वहां से लसी का स्राव होना ही चाहिए। दूसरी बात, वहां का स्किन का जो रंग है वो कबूतर के वर्ण के समान ही होना चाहिए। तीसरी बात, वहां से ऐसी ध्वनि आना ही चाहिए। छट ऐसी ध्वनि आना ही चाहिए। ये रही अग्निगर्भ की बात है। और दूसरी बात, जहां भी अभी बहुत सारे लोगों को बैकेट का प्रॉब्लम होता है, बहुत सारे बंदों को बैकेट का प्रॉब्लम होता है, महिलाएं तो बहुत सारा बैकेट बताती रहती है। इन लोगों में अगर आपने अग्निगर्भ करके देखा तो आप भूल जाओगे कि भाई इसको कभी बीमारी थी। करके देखिए, मैं यकीन से कहता हूँ 100% नहीं, करके देखना चाहिए आपको। जिन महिलाओं में बैकेट है आप करके देखिए। सभी आप अपने को कल मर्मस्थान बताएंगे, मर्मस्थान को छोड़कर अगर ये काम करेंगे ना तो बहुत सारे रिजल्ट अच्छे आते हैं। सर आपको बोलता हूँ, मैं मेरे गांव का एक पेशेंट था, वो बैलगाड़ी से गिर गया, कुकुंदर मर्म उसका डैमेज हो गया। सर्जन ने उसका सर्जरी किया सर, ना उसका 10 साल हो गया है, he is unable to walk. He is unable to walk. Why? मर्मस्थान उसका विद्ध हुआ है और सर्जन ने उसको ऑपरेट किया, डबल आघात हुआ है, अभी भी वो चल नहीं पाता है सर। इसलिए आप जो डिस्क्राइब कर रहे हैं मर्मस्थान, वो हमारे फ्यूचर प्रैक्टिस के लिए बहुत 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 जरूरी है। अग्निकर्म भी करना है आपको तो आपने भी ये मर्मस्थान छोड़कर अग्निकर्म करना है। रक्तमोक्षण भी करना है, शिलावेद भी करना है या प्रच्छान भी करना है, मर्मस्थान को छोड़कर करना है, यानी कि मर्मस्थान के ऊपर तो बिल्कुल नहीं करना। I have an experience that one lady, near about 28 years old, having dizziness in her eye and extreme pain in her eye. She went to ophthalmologist. I don't know what her diagnosis was, but she advised her patient to undergo an operation because her eye became totally white and only one eye was not. Left eye was totally white. जैसे कि अभी सर ने आपको बताया, आवर्त मर्म के बारे में सर ने बताया, हमने वहां खाली उसको विद्युत किया और 100 ml का मात्रा बस्ती दे दिया। उसी दिन वो पेशेंट को रिलीफ मिल गया था। इतना महत्व है ये मर्म स्थान समझने में और उसका ट्रीटमेंट अच्छी तरह से करने में, इतना फर्क है। यानी कि आप बहुत सारे लोगों का ऑपरेशन भी दूर कर सकते हैं। प्रैक्टिकल है, कल आपको पूरा वीडियो के साथ दिखाऊं, नो प्रॉब्लम। तो मैं भी कंक्लूड करता हूँ।
थोड़ा सा कैसे करते हैं वो भी दिखाएंगे सर?
आपको तो दिखाएंगे ना, वीडियो है मेरे पास।
नहीं, लाइव भी थोड़ा सा ट्रेनिंग सेशन है।
ठीक है, थोड़ा केबल लगाओ,
केबल वीडियो दिखाएंगे।
हाँ वीडियो है।
नहीं, मैं कह रहा था कुछ डेमो, कोई पेशेंट यहाँ पे या कोई ऐसा, जैसे आप रक्त मोक्षण करते हैं ना,
हाँ
तो रक्त मोक्षण का एक लाइव यहाँ पे किसी को करके ही दिखाते हैं फिजिकली जैसे आप करते हैं ना।
हाँ,
तो वो अभी करके दिखाएंगे सर। आपको सीरीज चाहिए ना?
सीरीज मेरे सब कुछ है, लेकिन
कोई
यहाँ नहीं
बंदा
लाया
चाहिए।
मैंने, यहाँ नहीं लाया।
तो मंगवा देते हैं।
नहीं, कोई जरूरी नहीं है, आप काम करेंगे, वीडियो दिखाएंगे ना उनको। कोई अभी जो बोल रहा हूँ मैं,
नहीं, आप
वही
चाह रहे हैं
वीडियो है मेरे पास।
हम ये चाह रहे हैं कि कुछ लोग ना यहाँ पे
कल सिखाएंगे, हम लोग कल सिखाएंगे।
तो उसके लिए क्या क्या चाहिए हम मंगवा देते हैं।
है मैं लेके आया हूँ।
तो हम यहाँ करके दिखाएंगे
जी।
आप में से आपको कैसे रक्त मोक्षण करना है, हाउ यू हैव टू डू द रक्त मोक्षण।
सो अभी मेरे पास जो वीडियो है उनको दिखा देते हैं।
तो वीडियो तो हम वैसे भी देख लेते हैं ना, वीडियो तो YouTube पे रहते हैं।
सुनो, अभी मुझे सामान लाने के लिए 15 मिनट लगेंगे।
अभी नहीं, लंच के बाद। ये जो पार्टिसिपेंट है ये आपके साथ में हैंड्स ऑन ट्रेनिंग कर,
वही तो मैं दिखाऊं रहा हूँ। मेरे पास जो है, मेरे पास जो है मैं दिखा रहा हूँ।
लंच के बाद ना, लंच के
अभी
दिखा दो आप।
हाँ, ये थोड़ा सा केबल लगाए,
केबल उसमें लगाना है मोबाइल में।
मोबाइल
वो अभी ना टेक्निकल पर्सन
इसको भी चार्ज नहीं चार्ज
मोबाइल में है
यूट्यूब में तो यूट्यूब बता सकते हैं तो ओके
ये डिस्चार्ज हो रहा है थोड़ा आगे करना है लैपटॉप का चार्ज ये बंद हो जाएगा
चार्जिंग
हाँ ये चार्जिंग लगाना था इसमें
लंबा नहीं है तो ये थोड़ा इधर देना थोड़ा इधर खींचो मुश्किल और थोड़ा साइड में करेगा बाद में मुश्किल इधर ही होगा और
बंद हो गया इसको थोड़ा इधर करना
चलो अपडेट योर डिवाइस सेटिंग्स ये क्या आ रहा है
will update your previous accept
मीडिया ट्रांसफर फाइल ट्रांसफर बस
तुमसे शेयर करके सब देख लेंगे अभी तो है तो आ तो गए
परिश्रम 107 परिश्रम सबसे ये मोड़ है इसके अंदर